have a long list of people who have signed up, who have submitted written testimonies for the bills today, and people who are going to be calling in to testify also. So I want to quickly get underway in the most efficient way we can think of doing this. Before we get going, I want people to know we're in a very large room with a window open and only about 4 people present. So I'm going to take my mask off so I can concentrate more on getting the committee going. The first thing we need to do is to take a roll to produce a quorum. Clerk?
Senator Bell.
Here.
Senator Calkin.
Here.
Senator DeMario.
Here.
Senator Golden. Senator Lawson.
Here.
Senator Paolino. Senator Valverde.
Here.
Senator Miller.
Here. So we do have a quorum. What I would like to do in order to save time and energy for both people who are calling in and the staff and the senators of the committee is to have a hold for further study on the bills. I've been told by legal that we need to have a separate vote for each bill, and then I'll have each senator who is interested in presenting on their bill, present on their bill as they're posted. So Senator Bell will go first after we
Mr.
do.
Chair?
Yes.
So I've been thinking about this, and I was wondering if this was actually going to happen tonight.
Yeah.
I feel very uncomfortable voting on an action on a bill that I haven't heard yet.
Okay.
And I noticed like other committees are doing this as well, but
Yeah.
you know, for me, I understand wanting people to be able to communicate and testify on a bunch of bills at once. Is there any way that we can just bring them forward without actually having the vote to hold them prior to introduction?
I'm willing to do that. It's just we do have over 100 people signed up to call in, and at some point we may lose either a quorum or a few senators, or they might not be present for the hold vote. So it's up to the committee. I'm willing to have it run the way you've described. I'm very comfortable with that. If you think we're going to have a quorum at the point that you feel comfortable with a hold vote.
Yeah, I guess
we could hold
my main concern is that it's considered, you know, that the bill has been considered, so that
Right.
even on a good bill, if we hear a good bill later on that we would like to come to the floor, that the senator wouldn't have a chance to be able to do a discharge or something like that, because
I agree with you.
Further study.
It's a good point, and I agree with you. And so at some point, if we can all, myself, I'll try to keep track. If we feel at some point where senators are no longer present or aren't able to hang on near the, you know, an hour or so from now, then I'm totally fine with, if we recognize that we do have 1 or 2 people that are going by the wayside, that we can at that point make the vote. So I'm happy with making the vote later.
Thank you for considering that.
Yeah. So just raise your hand if any of you see that and I don't, and we can go forward that way. So with that in mind, we won't take a vote right now on holding the bills, okay? And we will hear the testimony in the order that the bills are posted without having a motion on any bill. So, and I do want people to know also, as we get into the calls, those who are watching in anticipation of being called, I want to give them a heads up. The way it's organized, so we can see whether people are signed up for more than one bill. The easiest way for the staff to organize this is actually by first name of those who are calling. So to give you an example, Adam Cable is first, and one of the last people would be, just so people can figure out how long they might have, Xantha McCartney or William Colwell, or Jonathan with a Y, Daniel, okay? So to give you those who are waiting to be called and a heads up on how long they might have to wait, okay? So with that in mind, what I will do is ask Senator Bell to present on number 49, Senate resolution respectfully requesting the Rhode Island State Auditor General to conduct or oversee a study or audit on the privatization of Rhode Island's Medicaid program. Senator Bell?
Thank you so much, Mr. Chairman. So what this legislation would do is direct the Auditor General to conduct an audit on the privatization of Rhode Island's Medicaid. So for those who don't know that much about Medicaid policy and the details, Medicaid in Rhode Island is privatized for most cases. If you're on Medicaid, in most cases, usually you're on a private insurance company, usually Neighborhood or United, in a few cases, Tufts. And so the state Medicaid program contracts out to a private insurance company, which then delivers services and pays for health care for Medicaid patients. And in Connecticut, after Medicaid privatization was tried, there was an audit done in 2009 that determined that Medicaid privatization was causing overpayments and essentially waste of public money and did not produce a better quality of service. And similarly, this has been an issue in other states. Prominently recently, when the Republicans took control in Iowa, they privatized the Medicaid system. And I had a conversation with an Iowa state senator who was telling me a lot about many of the changes and why he found it very problematic, and the Iowa Democratic Party was very upset about it. And I thought, well, we have the same system here in Rhode Island. So I did some research about the process and the right way to move away from this, and I thought the right way would be to start with something like the audit done in Connecticut. And after that audit, actually, Connecticut wound up de-privatizing their Medicaid system. Now, one of the important things about the Connecticut de-privatization, and I think it's an important lesson that we can learn from, is that Connecticut found a way to de-privatize while still working on care quality metrics within payment models. And I think that's often something that's brought up as part of this conversation. Connecticut found a way to de-privatize while doing the same thing. So I think that's really important. The other really interesting part of this is that the Auditor General in the Auditor General's reports year after year identifies a lack of this audit as one of the main problems with understanding exactly where the money goes in such an enormous part of our state budget. We have enormous amounts of money that go into Medicaid, and then they go into this black box within these insurance companies. And we really need an audit to look inside the books of the insurance companies that are spending such a large percentage of state money. And even if it doesn't ultimately lead to de-privatization, I think we would learn a lot about what is actually going on with such an enormous chunk of the taxpayers' funding that we spend in our state budget. So with that, I'd be happy to take any questions.
Any questions from the committee for Senator Bell? If not, Senator Calkin, do you want to go?
Senator Valverde had a question.
Oh, okay. Senator Valverde?
Thank you, Chairman. Senator Bell, are there any other states that you're aware of that have undertaken a similar audit besides the ones that you mentioned?
I think Connecticut is the only one. This really was inspired by the Connecticut audit. A number of states have privatized Medicaid. Connecticut is the main example of a state that has privatized Medicaid and then done an audit and then decided that it actually wasn't a good idea to privatize and then moved back in the other direction and deprivatized. So it's really only Connecticut that I'm basing this off of. The idea really comes from Connecticut. Other states have had policy conversations about whether Medicaid should be privatized, but the idea of doing an audit and really studying it comes specifically from Connecticut.
Any other questions? Thank you. So Senator Calkin, do you want to give us overview of Senate Resolution number 109, respectfully urging the United States Congress to pass legislation establishing an improved Medicare for all single-payer program that would provide universal, comprehensive, and affordable health care?
Yes, thank you, Mr. Chair and fellow members of the committee. So as Mr. Chair said, this resolution would ask members of our congressional delegation and the federal government to implement an improved Medicare for all single-payer program, and respectfully urges Congress to pass the legislation. Everywhere I go, I hear from people that are concerned about the rising cost of healthcare and how they fear that their parents, children, and families will not get the care they need if we fail to implement a national single-payer healthcare system. They, like me, believe that every person deserves healthcare as a right, and that how much money you have shouldn't determine whether you live or die when you get sick. Single-payer is widely supported nationally. In fact, 2/3 of voters support Medicare, providing Medicare to every American. A single-payer system has also been endorsed by 635 union organizations and 22 international national unions, including the USW, UAW, and the NEA. So asking a federal delegation to support and advocate for Medicare for all is a small step, but it would mean a lot to all of those Rhode Islanders that go without medication, who skip doctor's appointments, go bankrupt, or even die because they don't have the ability to get the health care they need. So now is the time to say that we're going to put people before profits, that healthcare is a basic human right, and that we can no longer perpetuate an insurance industry that makes money off of denying people access to care. So thank you very much.
Any questions for Senator Calkin? If there are none, we can move. I think Senator Mendes is on our Capitol TV link if she wants to. Is she there? Oh, great.
Hi, friends. How are you?
Good. And you're welcome to stay on the link as long as you want, because there will be people testifying on your bill throughout our hearing. So.
Fun. I look forward to it. Thank you for the invitation.
Yep. So you can go right ahead on 230, Senate Resolution creating a special legislative commission to study and assess the implementation of Medicare for all single-payer program in Rhode Island.
Thank you, Chairman Miller.
Yeah.
So in the U.S. right now, 2/3 of personal bankruptcies have been due to medical costs. And of these, 3/4 of those bankrupt, lost health insurance or were undercovered. Rhode Island, the need for this study is urgent and basically overdue. To help our families in Rhode Island right now who are experiencing underinsurance or unaffordable insurance at record numbers. We have over 40,000 Rhode Islanders right now that are either not covered or undercovered by their current insurance. I remember, even well before I thought about getting into office or running for office, taking my daughter to the soccer field, and we had multiple events. That's a time where people gather together, and far too often we were talking about how we were going to get a fundraiser going in the community to help someone pay for their cancer treatment, and because too often mothers were having to choose between paying their mortgage and paying their medical deductible. In addition to that, moving forward, this is a low bar, by the way, having assembling a commission to do a study. I'm very interested in finding out what this study will result for small businesses. We spend a lot of time right now, especially concerned with impact right now that COVID-19 has on small businesses. But one of the ways that we know that we can help small businesses is by providing Medicare for all. Small businesses oftentimes have a hard time keeping up with larger corporations and being able to provide healthcare. The healthcare costs continue to rise anywhere from 8 to 12% annually, and small businesses struggle to be able to afford healthcare for employees they deeply, deeply care about. And in a way of being able to create equity and looking out for small business owners and giving them a chance to survive, Medicare for All is another path to looking out for small business owners in our community. In addition to that, I have heard from people in my community that are just curious about why we haven't had Medicare for all yet. Why when it is just so universally popular? And so I think, we have moved and addressed with the Affordable Care Act as much as we possibly can. We know it is now secure and safe under a new federal administration. And so now is the time to go ahead and give them the confidence that we are taking them seriously, that we are listening to them, and that we, at the very least, can assemble a commission to study Medicare for all and to be able to produce results for them on what that means for Rhode Island. Because far too often Medicare for all is dismissed as not possible, but we haven't actually studied it. And it is possible, and I'm confident between my bill as well as Senator Calkin's bill and Senator Bell's bill that we will be able to make strides toward Medicare for all and healthcare justice because healthcare is a right.
So when you talk to people about this effort and this bill specifically, does it come up the complexities of trying to pass a bill that would locally, or the feasibility locally, or the complexities locally, and what I mean state by state, Rhode Island, on reforming a federal program and how we can reform a federal program? Because we're asking
I think, some people are curious about the complexities, and that's why this is not a standalone effort. There's an effort by Senator Calkin to go ahead and have this addressed, have our federal delegation address this on a federal level. In addition to that, we look to, I have a community that's, well-traveled, and we have a lot of people that go to Canada, and they know that it's possible there. And Canada piloted it first in one area and then went ahead and branched across their country. And so they know that it's complex, and they know that it can't always be done initially nationwide. And that's why maybe Rhode Island should decide to be on the leading edge of healthcare justice rather than kind of trailing in at the end. So it is possible. People are aware it's possible. They understand that it's complex, but they also understand that it has to start somewhere. And Rhode Islanders, I believe, deserve to be the place to benefit from healthcare justice.
Thank you. I do want to let the senators of the committee and Senator Mendes know that every chair of every committee has an attorney, and that attorney, before we present on any calendar day, provides us with some thorough notes on both generally and very specifically to the language of the bill and where the challenges may or may not be. And I've asked our attorney, Don Weinberg, to send, if they are interested, the notes specifically on their bill and the challenges, both technically and generally, to their bill. And, one of the challenges that is well known and has been known for a long time is the challenge of when you try to reform something that is basically in the hands of the federal government on a state-by-state basis, there are a series of challenges. And how many of those can be overcome and how many of those remain very difficult to implement. And so I've asked them, and any of you who are interested in getting those notes and that feedback on your specific bill, we can make sure that you get in touch with Mr. Weinberg directly to get the information that he supplied me on your specific legislation.
I deeply appreciate that, Chairman, because having that input is valuable, and because there's nothing more challenging than seeing 40,000 Rhode Islanders without health insurance. So if we are going to take on a challenge, I deeply appreciate all the input to take on the real challenge, which is not being okay with 40,000 people being undercovered. And so
Right.
whatever challenge that we decide to take on together as a body, I'm sure that we would have full support, as you just demonstrated by providing feedback, in order to never allow that again. Thank you.
Thank you. Any questions for the senator? Senator Calkin.
Thank you, Mr. Chair. And thank you, Senator Mendes, for putting in this legislation. Obviously a fan in the past. And I do agree with you that it was, if this can be done in Saskatchewan with 1 million people, same size as the state of Rhode Island, that it's definitely doable. And also to point out what we're talking about is the processing of claims. We're not talking about changing doctors or where you go, to get your prescriptions or any of that. It's just the actual who gets the bill and pays it, right? It's something I think that Rhode Island has a lot of smart people that could actually, if they got their heads together, could implement something like this. Especially if we're talking about just a study commission. We've got a lot of bright people who could come together. And one thing I'm not sure if you've looked into, but I know back in the day I was really looking into what it would save for our cities and towns by doing a Medicare for all. We know that a lot of cities and towns have problems with their, healthcare costs. Here in Warwick, it's a big issue. So it would be great to have a study that actually determined how much money could be saved to cities and towns by implementing a single payer type of system here in Rhode Island. So thank you for putting forward the bill.
You're welcome, Senator Calkin, and thank you for remembering the area of Saskatchewan. I could not remember that, so in Canada. So thank you so much for that. And yeah, I love East Providence. I love Pawtucket, and so to know that the municipalities could also benefit from getting just a breath of fresh air and be able to catch their breath here and not having to take on those costs is just an added reason to go ahead and take on that challenge. So thank you.
Just one comment on the cities and towns and how they could save money or what could be expensive to them. As we're thinking about this, another, and I'm sure we'll come up with other legislation, is what's impending as the proposal of a hospital merger. And right now, it could have more of an implication in a hospital merger than this type of legislation, because most cities and towns currently, without single payer, are self-insured. And so they're paying for claims out of their self-insurance system, which is basically out of their budget with some controls on it, but not a lot. It's still very expensive if cost of health care goes up. So one of the things that cities and towns should start anticipating is could there be an implication for them on the expense of health care under basically a 80% being one hospital entity system within Rhode Island if the merger goes through, and therefore they have the market power, as happened with partners in Boston and Eastern Massachusetts, where rates went up a minimum of 30% for a lot of procedures, and it had a serious impact not only on insurers, patients, but also cities and towns. It was really a budget buster for a lot of cities and towns. And so it's other legislation, but you brought up cities and towns, and I think it's a consideration we'll have to take when we approach that subject also.
Thank you, Chairman.
Yep. Senator Golden, do you want to present on Senate Bill 231, an act relating to insurance health care for children and pregnant women, allows pregnant women with their annual family income above applicable Medicaid income limit to be eligible to purchase health insurance through our Medicaid managed care plans. I believe we passed this in 2019. Senator Golden?
Thank you. Thank you, Mr. Chair. We had passed this bill previously in the Senate. It is interesting to do it on the same day that we're doing Medicare for all bills and single payer health insurance, because if we had a single payer system, this bill would be relevant. But since we don't, it is necessary. Every year there are children born in Rhode Island. While we have an extraordinarily high percentage of people who are insured in Rhode Island, which is good, and a very high rate of childhood prenatal care, there are still children born in Rhode Island that are born without health insurance, and neither the birthing parent nor that child are receiving appropriate prenatal care because of that lack of health insurance, nor necessarily the follow-up care. If they become income eligible at birth, that child immediately becomes covered by Medicaid. If they have a birthing parent who is would have had access to health insurance, for instance, through an employer, and they give birth, that is a qualifying event. And so then they could get health insurance right in that moment. So it's simply unethical for us to be preventing children from receiving, and their birthing parents from receiving, the care that they need prior to delivery, merely because the way we have set up the healthcare system. The solution I've laid forth is really designed to help people who are perhaps right above the income threshold for Medicaid or otherwise don't qualify, to be able to buy into the Medicaid system should they find themselves pregnant. And the idea being that you can always access Medicaid if you're income eligible. So if you become pregnant and are income eligible in that moment, you certainly can access Medicaid. But if you are above the income threshold, and you have no other way of getting health insurance. So this is a way of trying to increase the number of children born in our state health insurance, and actually the amount of children born without health insurance, without being covered by health insurance, is low enough in the state that I believe we can get ourselves to every child covered, and that is my ultimate goal.
So I know in previous years you've been able to present an estimate of how many mothers this actually would cover. And I think that's one of the reasons it was seen as a very viable piece of legislation to consider and pass, and how many mothers this actually impacted. I believe at least one of those years it was 80 people.
Yeah, I think it's I don't remember the exact numbers, and I didn't see if Kids Count had submitted legislation. They're the ones who've been tracking that information.
Yeah.
So I don't know if they're on to testify today, but that would be a good question to ask them.
Okay.
I think that, when I've asked for the health insurance companies to give me more data and Medicaid to provide me with more data, we can definitely see that there are many people in the state who are uninsured at the time they're pregnant and then become income eligible for Medicaid, find out that they're income eligible for Medicaid and do use Medicaid to cover that health care. So there is a pretty significant amount of people, but then a very small, under 100, then do give birth without health insurance. So it isn't a huge impact for the state in terms of the number of people, but obviously it's a huge impact to those families themselves.
Yeah.
And I think also, if we're looking at COVID, we can see for, it's well documented that the impact of women being forced out of the labor market, either because of losing jobs, or having to provide caregiving that's unpaid at home, as we closed our schools and our child care centers and elder care and all the kind of things that women are disproportionately required to provide. And so women have left the workforce in droves, which obviously impacts their access to health insurance as well.
Any other questions for Senator Golden? Senator Bell?
Thank you so much, Senator Golden. I think this is an excellent piece of legislation. One of the things I think about a lot that comes up very often in my constituent service work is Medicaid terminations. And I think, as a lot of us are aware, Medicaid terminations have been heavily slowed down during the federal state of emergency. And so we have a large amount of people who are currently ineligible who are on the rolls who will all be purged once that federal protection expires. And so it could be as much as 100,000 people. We're likely coming for a very large number of people who are going to suddenly lose access to their Medicaid. And one of the things I really liked about your bill is the possibility that people who want the Medicaid level of coverage and often aren't able to obtain it on the private market, even with the exchange or through their jobs, may be able to maintain that. And I'm wondering if this could work well as something that could be integrated into the Medicaid termination process. So if people are terminated during pregnancy, they would be able to maintain many of their similar health insurance and benefits by buying in through this program, and whether it could be integrated into the new way we're going to have to address terminations.
Thank you, Senator Bell. My intention was to make this as streamlined as possible for people in order to ensure that there aren't gaps in their care. So that's certainly something we could talk to the Medicaid director to find out if there's, if they would anticipate that there would be some additional legislative change that would be necessary in order to make that happen. But otherwise, I would imagine that it would take care of that problem.
Thank you.
Senator DeMario?
Thank you, Mr. Chairman. I just wanted to speak for a moment about the impact of what Senator Golden was just speaking about those lapses in care and why that is so critical, especially during the time period of pregnancy. Because I think that, if it maybe has been a while since a person has experienced pregnancy or, isn't well acquainted with those standards of care, it's just so important to know how essential those regular visits are during every point in pregnancy, and the impact that a few missed visits during some critical windows and not being able to monitor certain situations with the health of both the pregnant mother and her growing baby can have negative impacts on even infant and maternal mortality as well as health and development. And so that's one of the reasons why I think this is so crucial, is that when there is that loss of employment and then that even little bit of a gap, a couple months of a gap, I think sometimes we minimize how crucial that can be during that event of pregnancy. And that's why I strongly support this bill and why I think that's just so critical to pay attention to.
So I think that gets to historically why this bill has been supported, at least in the Senate, is the analysis that we heard from and read about from especially Kids Count, in that the cost of an uninsured mother and baby to both hospitals who are giving uncompensated care, and then the trigger to their Medicaid coverage once the child is born actually is more expensive than the Medicaid enrollment itself. But the reason it historically hasn't passed and been brought to a governor's desk is that there has traditionally been an analysis that we are still looking in a budget cycle of enrolling 80 more people onto Medicaid. And they're not looking at the rest of the data that was presented to us on it's actually a cost savings if you look beyond that initial enrollment period and initial enrollment cost. So it's an important component, and hopefully this year, if we look forward to passing it after reviewing the technicalities in the bill that might have to be updated, that we can get that wider perspective of how you analyze this and analyze cost to the family, the baby, and the state. So, and I'm sure we'll hear that from people testifying later. Are there any other questions on Senator Golden's bill? If not, we'll move on to Senator Bell's to present on the final bill before the committee, which is Senate Bill 233, an act relating to health and safety comprehensive health insurance program, establishes a universal comprehensive affordable single-payer health care insurance program, which shall be referred to as the Rhode Island Comprehensive Health Insurance Program. Senator Bell.
Thank you so much, Mr. Chairman. So what this legislation does is establishes a process to move Rhode Island to Medicare for all system at the state level. One of the really constant things I hear from my constituents is the struggles people have with paying for health care. I think it's a constant in just about every Rhode Islander's life. And, even if you are insured, sometimes because healthcare is such a necessity, it's really something that you really absolutely need. Sometimes the insurance companies will make you pay for things that can really hurt your budget. I had extensive physical therapy, which enabled me to not have to wear leg braces to walk anymore. It was a huge improvement for my life. And throughout maybe about 2/3 of the way through this course of physical therapy, I was told that actually the insurance company was going to charge more than twice what I thought I was paying out of pocket, and I had to go back and pay almost $70 a visit, which, because it had been more than 10 visits, was quite a lot of money for me at the time. But I paid it because it was so important to me to be able to walk without leg braces. And I think people often have the same experience. Sometimes when it's something you absolutely need to stay alive, because we have an employer-based healthcare system, people are often very afraid of what will happen if they lose their jobs. My wife is a type 1 diabetic and needs insulin to stay alive, and if we lose our jobs, we won't have health insurance coverage, and we won't be able to cover the medicine she needs to stay alive. And that's very scary to us. Even though, we both have jobs, we both have insurance, it's still very scary for us. And so the idea of a Medicare for all system is to take away the idea that healthcare is all tied to insurance and just make it a fundamental basic human right. And by getting rid of all of the complexities of medical billing, you can actually save quite a lot of money and wind up providing this care at a lower cost than we currently wind up paying for through health insurance premiums. And so the idea of a state-based approach, as Senator Calkin mentioned, comes from Saskatchewan, where Canada's Medicare for All program, which is called Medicare, was started in just one province in Canada and was soon adopted to the rest of the country. Under the Affordable Care Act, or Obamacare, there's a process that's laid out to move a state to a single-payer system. And this is important because I think it gets to some of the questions and details people often have about this legislation. The way it works is that you apply for a waiver to the federal government, and this waiver is really important. What it does is it allows you to convert multiple streams of federal revenue, Medicare, Medicaid, and ideally and crucially the employer tax exemption, employer healthcare tax exemption. And you can convert the federal streams, which are federal money that's already being spent in Rhode Island on providing healthcare, and you can convert them and use them to provide funding for a state-based Medicare for all system. Now, because it is a federally guided system, even more so even than much of our Medicaid policy, it all comes down to the details of that waiver. So that's why some of the terms of the bill are leave a lot of things open to design, and it sets up a process to guide that waiver application and to guide that negotiation at the federal level. So we don't necessarily know, we aren't able to fully cost it out because we don't know the exact terms of what the federal waiver is going to be. And I think it's also really important because sometimes one of the main sort of soft objections this bill gets is not that Medicare for all is a bad idea, but it's just such a big thing, such a large thing for this that we really need to dig into it and do an extensive analysis before we think about passing a bill. And the key point about this bill is it really is passage ready. It is true that we haven't yet negotiated all the details and had a long and comprehensive process to find out all the nuances of how such a complicated system will be built. But that's because it can't work that way under Obamacare, and it's required that we pass a bill like this to start that process and then have more collaborative process to get together and find out how we're going to put together all of the details. And so that's why this bill is written the way it is, and it's why it's passage ready now. In the past, when I've testified on this legislation, when we had a different president, I was pretty upfront that I did not think that the previous president we had would be likely to sign such a waiver. And so passing this legislation, it was sort of the idea that we would wait for a Democratic president. But we have a Democratic president now, so I think now really is the time to pass this bill so that we can begin this process. And it's going to be a long and complicated process to iron out all the details and negotiate with the federal government, but it's something that we need to do because the injustice of the current healthcare system, where all of healthcare is laid at the hands of who has the money, who has the health insurance, who has a job, has caused so much pain and suffering in our country. And it's so unnecessary. And so many other countries have found a way to create a healthcare system where it's a human right and no one has to worry about going bankrupt just because they got sick. So with that, I would be happy to take any questions.
Any questions from the committee? Thank you. So what I'm going to attempt to do now is to go to those who are interested in calling in, and before we get to those calls, I want to send some general ideas of how we can get through this most efficiently and be fair to everybody who has called in and have also submitted written testimony, because as all the senators know and all the staff know, we have, in addition to all the phone calls, a substantial amount of written testimony. So first of all, I want people to clearly let us know if they represent somebody besides themselves individually, and then clearly let us know what bills they are testifying on, if it's more than one bill, or if it's one bill, what bill they're testifying on. And then I would implore people, there are two systems under what we're trying to do remote to be careful about COVID, is to set up a system that is still as fair as technically and feasibly possible. And so we've set up two systems, if you're willing and interested in participating by either submitting written testimony or calling in. And so to be fair to those who choose to call in, and they have also submitted written, I would ask them to indicate they have submitted written and ask us to refer to the written testimony that we already have to them, and to paraphrase rather than read what they have submitted written, so that we can not only get to everybody, but be fair to the two venues that we've supplied. That there are people who called in because they prefer to speak on the bill versus people who preferred to submit written testimony, and not to have people be redundant to both. And if they are paraphrasing written, to let us know so we can refer to that rather than have the entity of their written testimony presented as something that we already have received. So with that, Clerk, the first call you have is, okay, the first call we have is Allison Charlotte Phillips. Allison? Allison?
Hi.
Hi, you're on with the
This is-
committee. Go right ahead.
Hi, my name is Allison Phillips. I'm here to testify in support of Rhode Island Bill S0233. I'm a lifelong Rhode Islander. I was diagnosed with the chronic autoimmune disease a decade ago. In that time, I've been on private insurance through my parents. I've been on Medicaid, then insurance offered through the ACA marketplace, and now on employer-sponsored private insurance. The medical needs of my body have stayed the same, but the accessibility and cost of my care have varied dramatically. I know firsthand how difficult it is to have to portion so much of my income just to keep myself healthy enough to work. instead of saving that money to pay down medical debt or save for a house or retirement. I've seen my insurance premiums rise right alongside or greater than my pay rate increases, so the burden of these costs has not declined throughout my career advancement. Rhode Islanders like me need to be able to access quality, affordable health care at all stages of life and at any income level. The state's comprehensive health insurance program would have the ability to negotiate drug and service costs in a way that state private insurers can't, saving taxpayers and patients, one and the same here, money. I and most young adults I know have put off medical care because we could not pay for it. No one teaches you that you can shop around for blood work at different labs because your insurance got a better deal with the one across town than the one in your doctor's medical building, saving you $500. The idea of a free market in healthcare is absurd when patients are not informed or equipped to easily shop around for the best price, and when shopping around for healthcare takes days or weeks of precious time, especially when you're ill. Patients clearly benefit from better pricing agreements between insurers and providers in reduced cost, but also in less time spent searching for the most affordable option and more time spent on getting better. In addition, when people access the preventative and maintenance health care they need, the long-term health care costs per patient decrease. When people don't avoid the doctor's office because they can't afford it, the disease burden is lessened on the entire system, improving so many people's quality of life and saving taxpayers money in the long run as well. Improving Rhode Islanders' quality of life, reducing the financial burden of healthcare costs on most residents, including myself, and lessening the cost to taxpayers by having better negotiating power with the providers are all reasons to consider and pass this bill, 0233. I thank you for your time.
Any questions for Allison? If not, thank you very much for calling in. We appreciate your testimony.
Thank you.
Next person calling in is America Foster. America?
Speaking.
You're in front of the committee. If please tell us what bill you're interested in testifying on.
The bill is S049.
Okay. And have you submitted written testimony along with calling in?
I did not submit any written testimony,
Okay.
no.
Go right ahead.
So, hello, my name is America Foster, and I am a medical doctor in the state of Rhode Island. I am here to express support for Bill S49 because I am concerned, especially during the COVID-19, about our lack of affordable, comprehensive, universal coverage that only Medicare for all single payer can achieve. I support this bill because we can't keep cutting Medicaid funding without knowing the true cost of private insurance managing healthcare coverage. I'm nervous that what happened in Kansas and Iowa is going to be happening here in Rhode Island. They suffered cuts in care, reduced far less cost than expected, and sacrificed oversight and transparency by handing their programs over to private entities. But who suffers when this occurs? Our Medicaid community suffers. So prior to 1994, providers were paid directly, eliminating the middleman. But as soon as a third party gets involved, they want their share of the pie, sacrificing coverage. They make money by restricting healthcare providers and the coverage, as well as coverage for patients. They don't actually provide health care. There was a patient of mine diagnosed with asthma who was having progressive cough. So after I ruled out that she did not have COVID, I ended up doing an x-ray because the cough continued. She ended up having metastases, but I did not know from where. So I suspected that it was that the source of her cancer was from her kidney. But because she was a member of NHP, they refused to do any further imaging, citing that it was not necessary. The back and forth with the insurance company delayed her diagnosis by 3 weeks. she eventually died. I can't help but think that if it wasn't for all the red tape that this 58-year-old woman had to undergo before actually getting the imaging she needed, that we could have actually had a better outcome. There's something wrong when hospitals are closing its doors and private health insurance companies are thriving. Hospitals suffering, patients not getting the care they need, and the insurance companies are doing quite well. I support the S49 bill, so please conduct an audit on the privatization of the Rhode Island Medicaid program. Thank you.
Any questions for Dr. Foster? If not, thank you very much for calling in.
Thank you very much. Have a good evening.
Yep. Next person is Ames Colt. Mr. Colt? Mr. Colt? Mr. Colt?
I'll dial him again.
Mr. Colt? Are you on? Mr. Colt? Maybe we should try that later and go on to the next caller, which would be Andrew Poyant. Andrew? Andrew?
Hi.
You're on with the Health and Human Services Committee. You're interested in testifying?
Yes. Is it possible to testify for both 109 and 233 at the same time?
Yes.
Okay.
Did you submit any written testimony?
I did not.
Okay, go right ahead.
So my name is Andrew Poyant. I am a Providence resident. I am also I'm in favor of both of these bills, 109 and 233. I am a union worker, which often gets pitted against Medicare for all as we fight for getting good medical insurance as a part of being a union member. And I don't consider my insurance particularly that good. I end up paying close to $12,000 a year for a family plan that I often have to call and fight with my insurance company for them to pay for things that they're supposed to be paying for. I have a deductible that I'll, have to take our kids to the doctors and end up getting. This week alone, we got two bills that added up in deductibles for more than $500. And you never know how much you're going to end up getting for a deductible bill until it comes in the mail after you go and see the doctor. And I have 3 little kids. Someone's always doing something that they end up needing to go to the doctors. So I would really support Medicare for all to make sure that we're all covered and able to get the care that we need. We shouldn't have to be avoiding getting health care because of the cost. So I just would like to urge you to vote in favor of both of these and bring it to a full vote of the Senate. Thank you.
Any questions for Andrew? Thank you very much for calling in.
Thanks.
Next, we're going to try Anita Bruno. Anita?
Yes.
Go right ahead. You're on with the Health and Human Services Committee.
Thank you. Hello, all. My name is Anita Bruno. I'm a carpenter, 15-year carpenter, and I want to say that I support the bill of the SO230, which creates a special legislative commission to study and assess the implementation of Medicare for All single-payer program in Rhode Island. I support this bill because I'm a single mom, and if I don't put in all my hours as a union carpenter, then I don't have health coverage, and it's very hard to afford health coverage in between. I think the last quote I had for just me and my son was $500 a month, and if I'm laid off and I don't have the hours and I'm not working, it's very hard to come up with that $500 a month, and Medicare for All would make it a reasonable rate for all families, including families like myself, who is a working mom, but I'm a single mom. So it would make it more affordable for a woman like me, a single mom, to afford a family health care plan.
Thank you.
Thank you so much.
Any questions for Ms. Bruno? If not, we'll move on to the next caller, which is Dr. Anita Keston. Dr. Keston?
Yes, thank you very much. My name is Anita Keston. I have both an MD degree and a public health degree from Brown University, but like everybody else, I'm also a patient. And I've seen for a long time that the healthcare system does not function properly. And with COVID, I think we can all see that the gaps in the system are much more visible to everybody else. I'm here to speak primarily about the bills concerning single payer, which is 233, 230, and 109. And I wanted to speak particularly about 2 issues. One is choice, and the second is why the public option is not the option we need right now. So first, on choice. We are often told that single payer threatens choice. Recently, a friend called me up and asked for assistance in choosing a private health insurance plan for her family. There are multiple plans from commercial payers to choose from, presented in a series of bewildering charts and colors. I dove into the fine print where I could, and in fairness, I did come up with some useful distinctions. But ultimately, even for me, this was a confusing proposition, and I could not confidently guide my friend, and none of the plans seemed really suited to her family's needs or tailored to the physicians she might consult now, and even less to those she might need in the future. Nor were the plans really within her budget once the effect of deductibles, copays, networks, and tiered drug pricing were factored in. This is not real choice, at least not the choice consumers want. This is the illusion of choice or faux choice. Single payer, in contrast, would offer the choices that your constituents actually want and need. All hospitals and providers would effectively be in the network, and patients could choose the facilities and providers that met their needs. This is in contrast to the situation we have at present, where health insurers can limit networks severely and can use network limits to discourage the sickest among us from choosing their plans. Now, the second thing I wanted to talk about was the public option. We are often told that single payer is too much for right now, but the public option is an improvement we can all get behind and feel good about. In contrast to single payer, the public option has some very clear disadvantages, and I will highlight just three. One, the system. Public option merely adds another layer of complexity to our system. It does not address the underlying problems, which include and are not limited to racial disparities, economic inequities, closing of necessary hospitals because they do not turn a profit, rampant price inflation for drugs, and the fact that insurance companies are not beholden to the public but to shareholders. Secondly, waste. The public option does not eliminate the mountain of forms that patients, your constituents, and doctors and their office staff must contend with for the smallest clinical service. It's a clear waste for all involved, and the current system creates what is accurately called rationing by inconvenience. Single payer would eliminate the need for truckloads of paperwork and allow providers to focus on clinical care. There is also waste in that we pay too much compared with other nations. The public option would not have the mechanisms and the clout to negotiate prices, but single payer would. And finally, public option is unsustainable. It's easy to see a scenario where the sickest patients are shunted to this option, thus increasing the cost of the public option and ultimately causing a death spiral that kills the plan and with it the opportunity and the appetite for meaningful reform. What has held single payer back in the past is political will, and that's why I'm appealing to you. A patient once explained the concept of Way-G to me. He described it as danger and opportunity. We are in a moment that is significant for all of us, a moment of danger when COVID may cause the collapse of our shaky, broken system. But now is also a moment of great opportunity to create the system that your constituents and all of our children and grandchildren will appreciate, namely single payer. I will close with an MLK quote: "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." Thank you very much.
Any questions for Dr. Keston? Thank you very much for calling in.
Thank you.
Yep. Anna Kastner is the next person we're going to try to connect. And before Ms. Kastner testifies, I want to remind people that if they had submitted written testimony or they're reading from testimony that they wish to email or send to us, to please paraphrase rather than reading something that will be sent to us or has already been submitted to us. Ms. Kastner?
Yes, I'm here.
Okay. Can you please let us know which bill you're testifying on? And if you didn't hear me before you came on, if you're submitting or you already have submitted written testimony, rather than reading it to us, could you paraphrase it so we can get to everybody in a very, very long list of people who are testifying?
Sure. So my name is Anna Kastner. I'm testifying in support of S-233, and I have not submitted any written testimony. This bill is so important because, oh, and I should mention that I am a constituent of Senator Gail Golden. I live in the Wayland Square area, and I just want to thank her for her support on these really crucial issues, especially now in a pandemic. Healthcare is a human right, and no one should be denied medical care based on an inability to pay. Just on a personal level, this issue is especially hitting home for me right now because I'm currently pregnant and incurring more medical bills than ever before. I am very lucky in that I have healthcare coverage through my employer. However, that's something that it is always subject to change. And in terms of navigating the healthcare system during my pregnancy, I spent a lot of time on the phone with my insurance company trying to figure out what is covered, what isn't, and what the out-of-pocket costs will be. And that's been an extremely frustrating process, especially, as someone who has the time to spend on the phone with insurance. It's taken up a lot of my time. I don't always get clear answers, and I've already hit my deductible for the year, and I had the misfortune of realizing that my benefit year ends in July, and my due date is in August, so I'm sure that I will incur another round of expenses at the beginning of my new benefit year. But certainly going through pregnancy is anxiety-provoking, and worrying about what my medical costs will be is just adding to my stress right now. And so with a Medicare for All system where it's clear what the costs will be and no one will be turned away from care based on an inability to pay, that would certainly make my life easier, and I know it would help many other Rhode Islanders in the same situation. So I urge everyone on the committee to support Bill 233. I hope that it comes up for a full vote soon, and I hope that everyone can lobby the other senators to make sure that this really important legislation gets passed. Thank you.
Any questions for Ms. Kasner? Senator Golden.
Oh, I just wanted to thank you so much for coming to testify, and to remind you, since you mentioned your pregnancy, that if you work in Rhode Island, you're likely eligible for paid leave. So please go to the Department of Labor and Training website so you can learn more about it in case you don't already know. Thanks.
Thank you so much.
Thank you, and I hope everything goes well through August.
Thanks.
Yep. The next person we're going to try to connect to be heard by the committee is April Lambert. April? April there? April? April?
Hello.
You're on with the committee. Please go right ahead and let us know what bill you're interested in testifying on and whether you have previously submitted written testimony.
I
am supporting the Medicare for all. Medicare for all.
Okay.
I did a form online yesterday to sign up to do a testimony, but I don't have any other things that I've submitted.
Okay. So go right ahead and give us your testimony then.
So the reason why I am in favor of Medicare for all, so currently for me, I am somebody who struggles with chronic illness. I have some disabilities that I do not get any I do not get any disability payments for. You know, in our country, it's very difficult to get on disability. I have been on Medicaid for several years, and without the Medicaid that I have, I would lose my medications that are life-saving. And if I go to work full-time, then I will lose my health insurance. Because, as you know, there's a income limit for Medicaid. I feel that Medicare for all would help people like me who have chronic illness be able to return to normal life, to participate in the workforce, and not be fearful of losing their health benefits. I feel like Medicare for all would be the correct step to remedy the large amount of people who are out of work due to disabilities, due to chronic illness, due to, you know, it's really, really difficult to find accommodating work, you know, already if you have chronic illness. But one of the things that really stops me from wanting to really return to work, obviously I want to work, I want to be busy, I don't like to be bored and not working. But if I get a job that pays enough for me to live on and subsist on, I will lose my health insurance and I will lose my life-saving meds. So for me, it's obviously a big thing for me, and I think that a lot of people would benefit, not just me. I'm sure there's a lot of other people who feel that they can't work because they will lose their health insurance and won't be able to feel well and survive and thrive. So that is why I support Medicare for all.
So, April, are you currently working part-time but not full-time because you're concerned you'll go off Medicaid?
As right now, because of the pandemic, I am not employed.
Okay.
In the past, I have worked part-time, and you know, when I was working earlier in my life, and when I was working, I was unable to afford health insurance. I was unable to afford going to doctors, and because of that, I did not seek treatment. So I've struggled the majority of my life with health issues just because I need to survive.
So thank you for testifying, and this has been a ongoing issue for many of us who've been involved in this issue, is how to get people to strike that balance between being concerned about employer coverage, no coverage, or Medicaid. And
and I think that having Medicare for all will help people immensely in their job search. You know, if we have Medicare for all, then people will be able to sign up for jobs that they want to do as opposed to jobs they don't want to do, because those jobs will offer health insurance benefits. So I think that having Medicare for all will help people not only thrive and be well and healthy, but also feel mentally and emotionally more fulfilled, if that makes sense.
Yes.
So I think that would be a big thing. People want to be able to do what they want to do to get by, and it's a big thing.
Yeah, and we also have the issue of employers not providing health insurance unless people work a certain amount of hours, and therefore
I've definitely had positions, jobs where I was limited on the number of hours I was allowed to work, so that they wouldn't have to pay for me to have health insurance benefits.
Yeah.
Especially when I was in my very early 20s.
Yeah.
A lot of the jobs I had, they would limit me to like 25 to 30 hours a week. And if I went more than that, they would send me home early so that they wouldn't have to, put me on health insurance. And, I didn't have health insurance until I was like 26 years old.
Yeah.
And I have many chronic health conditions. So, it definitely has drastically affected my life.
Yeah.
And I know there's many other people who are in the same boat.
Any questions from the committee? Senator Calkin?
Thank you, Mr. Chair. I just, I wanted to thank you for your testimony, and you can tell it's heartfelt, and, you expressed an issue with the current healthcare system, and that those that are just above the poverty line that can't get Medicaid usually fall through the cracks because they don't get insurance. And also want to thank you for raising some of the employment issues. Another one is the fact that a lot of people they don't feel like they can leave their job because they need that insurance so much. So thank you for raising those issues with us, and appreciate your testimony.
In a way, like you said, some people don't want to leave their jobs. In a way, that also traps people in jobs that are maybe abusive and toxic work environments. Maybe they have an employer, a boss who is like assaulting them or just disrespecting them, and like they can't leave because they feel like they need to be able to afford their health care. So, there's definitely a lot of people who would benefit. I have a friend right now. She's living out of a van, and she doesn't have health insurance. And she is, scared that, like, if she says she doesn't have a job, that she's not working, that she's homeless, that the government is going to, penalize her in some way. There's a lot of people who just have these fears. And they, if we had a Medicare for all program, it would allow people to get the proper health care they need, to get the proper, to get connected to the proper resources that they need in order to thrive and survive.
Senator Bell?
Mr. Chairman, thank you so much for your testimony, and thank you to everyone who's testified so far on this legislation. It's been, deeply meaningful testimony. I think you just made a really crucial point about your friend who's homeless and has concerns about signing up for Medicaid and doesn't have access to health insurance. And I think it's so important that we understand that when health insurance isn't seen as a universal right, and we don't have this universal assumption that you get this coverage automatically, the reality is a lot of people who are eligible for Medicaid don't wind up signing up. And sometimes that can be because of concerns that are valid or not valid. And sometimes there are cases where people who suffer from additional mental health concerns aren't really able to go through the process of Medicaid eligibility. And so our system to catch people at the very bottom, because you have to sign up, you have to go through the process of knowing you can get Medicaid, and then go through the process of getting it, I think it's so important that the lack of universality in the program, the fact that we don't have Medicare for all, means even people who are eligible for Medicaid sometimes can't get access and don't wind up getting access in practice, which I think is really, really a really, really important thing to understand about our current healthcare system. So thank you so much for bringing that point up.
You're welcome.
Thank you for calling in.
All right, thank you.
The next person we're going to try is our first B. We've gone through our A's, and there are 26 letters in the alphabet. Is Brandon Paris Sanchez. Brandon? Brandon?
Yes.
Go right ahead, and let us know whether you have submitted written testimony and what bill you're testifying on.
I'm doing the healthcare bill.
Okay. Did you submit any written testimony?
I have not.
Okay, go right ahead.
Sure. Just think that of all the developed countries in this world, the United States has the most money, and I think we're capable of doing this so other countries can. We spend twice as much as your average person in these countries on healthcare costs. Drug prices, hospital waste prices are out of control. We're ranked number 11 in healthcare in industrialized countries. I think it's about time we had our government start working for the people and not for insurance lobbies. Like, we all know what's going on. Drug prices are out of control. It's just, the whole thing is corrupt, and everyone knows it. We're also like one of the unhealthiest countries in the world, and I don't know, I think it's about time we start making a change and have our government start working for the people and get bills like this passed so people can live a normal, healthy life and not be drowning in medical debt. That's pretty much all I got to say, but thank you.
Well, thanks for calling in. Any questions?
No, thank you, though.
Yep. Next person we're going to try to get on the line to testify is Bruce Borowski. Bruce? Bruce, are you on?
Yes, I'm on.
Oh, great. Please let us know whether you've submitted any written testimony and what bill you wish to testify on.
I'm testifying for Senate Bill 233, and I have no written testimony.
Okay, go right ahead.
Thank you, Chair. My name is Bruce Borowski. I'm a resident of Providence in support of, as I said, Senate Bill 233. I'm only going to bring up one problem that this program, that Medicare for All program could solve. Currently, there's more than 40,000 Rhode Islanders who are uninsured. Another 400,000 have insurance policies with deductibles and deductibles that are high enough or coverage that is so little that many in our state only seek treatment when an emergency makes them do so. A Medicare for All style program here in the state would close that gap. In conclusion, I ask you to support Senate Bill 233. Our fellow citizens of Rhode Island deserve it. Thank you.
Any questions for Bruce from the committee? Thank you for calling in. Brian? Brian?
Yes. Yes.
You're on with the committee. Can you tell us what bill you're going to testify about and whether you've submitted any written testimony?
Yep. I'm here to speak about Senate Bill S233, and I do not have any written.
Okay, go right ahead.
Thank you, Mr. Chairman and members of the committee. My name is Brian O'Connell, and as a citizen of Rhode Island, I support Senate Bill S233. Everyone has a right to basic health care. This pandemic has made it clear that a comprehensive insurance program to make sure that every Rhode Islander has access to health care. As a certified peer specialist working in the behavioral health system, I have seen firsthand the devastating effects of someone not being able to get the proper care when needed. I have seen too many people lose hope when they try to get help and they are denied because they don't have the best health insurance or any health insurance and can't afford to go to treatment, and they end up dying by suicide, overdose, or continue to suffer through the healthcare system. As someone who struggles with depression, I was privileged when I was a teenager to be under my parents' health insurance, and I was able to get proper care. Now, working full-time, I am under private health insurance, and I would not be able to afford the care that I am receiving without working full-time. We cannot let private health insurance companies keep us from getting the health care that we need to survive and thrive. As the pockets of the health insurance companies are being filled, the citizens of Rhode Island are suffering and dying. This is a challenge worth fighting for, and will save the lives of Rhode Islanders that are needlessly being lost. A famous quote from Muhammad Gandhi springs to mind here: "The true measure of any society can be found in how it treats its most vulnerable members." Thank you for this time to speak.
Any questions for Brian? Thank you for calling in.
Thank you.
The next person we're going to try to connect to testify is Camille Shea. Camille? Camille?
Hello. Yes.
Hi. Thank you for calling into Health and Human Services. Can you please let us know what bill you're interested in testifying on and if you have submitted any written testimony?
I'm interested in testifying on Senate Bill number 233, and I have not submitted written testimony.
Okay, go right ahead then.
Okay, thank you so much. Thank you so much to everyone for your time. I'm Camille Shea. I have been working in the human services industry for the past 4 years. I'm testifying here in support of Senate Bill number 233 because I believe that it's incredibly important that every Rhode Islander have access to health care. And that's, when I say every Rhode Islander, I mean individuals of all abilities. This makes me very emotional because in my time as a worker in the human services industry, particularly with regards to providing services to individuals with disabilities in the state of Rhode Island, I've worked for a program that actually lost funding due to COVID-19 and was unable to provide services to individuals that would greatly increase their quality of life. And personally, I can't imagine what it would be like for an individual to not be able to afford services. It's literally a matter of life and death for individuals with disabilities. I have seen individuals be vastly neglected because of their inability to access healthcare, even if they have access to health insurance. And it's heartbreaking. The lab school closed in 1994. It's an institution that was originally built in 1908 and described as, I believe, Rhode Island School for the Feeble-Minded. It's an institution that was relatively recently closed in the state of Rhode Island, and I believe that this bill would be very instrumental in helping to continue to provide a high quality of care, to get back to providing a high quality of care to individuals with disabilities in the state of Rhode Island, in addition to providing a high quality of care to all Rhode Islanders. And these are Rhode Islanders. Some folks are nonverbal. They can't call in to testify. They can't advocate for their rights. So that's why I'm calling. Thank you so much for your time. That's all I have. Thanks.
Anybody have any questions for Camille? If not, thank you so much for calling in and testifying.
Thank you.
Yep. The next person we're going to try to connect with for testimony is Cassie Tharinger. Cassie? Cassie?
Yeah.
All Rhode Islanders.
Cassie, can you turn down the audio on your computer or whatever you're watching on?
Oh, yeah.
Thank
I'm
you.
listening to the hearing.
Good.
Yeah, I'll mute it when it's time.
So you probably heard me ask everybody what bill they're going to testify on and whether they've submitted written testimony.
Yep.
So go ahead and identify what bill you're going to testify on.
Okay. So my name is Cassie Theringer. I'm a resident of Providence, and I'm here to testify in support of the Senate Bill 233, and I have not submitted any written testimony.
Okay, thank you. Go right ahead.
Okay, so almost everybody that I know, like I think everybody else probably here, has experienced struggles, if not outright horror stories, in trying to access quality medical care. And I'm 40 years old. I turned 40 last week, and except for the period that I was enrolled in college, when I had the required kind of umbrella coverage through the school services program, until the ACA Act came into effect in Rhode Island in 2014, I had never had medical insurance coverage in my life growing up. We didn't have it ever because my parents didn't have it through their work and couldn't afford it on the private insurance market and didn't qualify for the existing state programs in Vermont at the time where I grew up. And then throughout my adult life, I've supported myself through multiple different part-time jobs cobbled together, as somebody referred to earlier, with, limited hours at each one, never enough to qualify if health insurance was even offered through them. Service industry jobs, bartending, waitressing, often in combination with part-time work at small nonprofits or independent contractors, never with health insurance. I also have spent most of my life dealing with chronic mental health issues, and the barriers, either the outright financial barriers, or the barriers of trying to navigate the Byzantine bureaucratic systems of subsidized health services or free clinics or patient assistance programs at hospitals is essentially prohibitive for if you're dealing with some mental health issues often. And I think now, looking back, that the fact that I was able to access and was one of the lucky people able to access health insurance in 2014 through the ACA and now through my husband's work, I often feel like that saved my life. And the idea that there are people who are not in that position and who are struggling constantly with those issues, with physical issues, with basic preventative wellness care is hard reality to face. So I would urge anybody with any position of power or ability to do anything to, I'm so surprised at how emotional I'm getting. I thought I was prepared for this. Anybody who has any position of power to do anything to address the moral outrage that is how we deal with healthcare in our state and in our country and our world, I would just urge you to do so. Thank you.
Are there any questions for Cassie? Cassie, I want to thank you for calling in and testifying. It was very important to the committee to hear from you.
Thanks.
I've just been told that we have some people who have to go onto a shift who are medical workers, and so I'm going to try to have them come after the next call, if we could skip after the next call that we already have on the line, to Rob Fain or Neha Reddy, if we can skip to them because they have to go on a shift. But the next person who is on hold to go to testify next is Catherine Hillary. Catherine? Catherine, are you with us? Catherine? We'll try Catherine later if we're able to loop back. Oh, okay. Catherine?
Yes.
Go right ahead, and if you've been following along Identify the bill or bills you're interested in testifying on and whether you submitted any written testimony.
Okay. I have a verbal testimony that takes 2 minutes to read. Is that okay?
Yep.
Okay. Just tell me when.
Go right ahead.
Hi, my name's Catherine Hillary. I'm from Newport, Rhode Island. I'm calling in favor of single-payer bills 109, 230, 233, and the audit bill S49. I'm testifying today to give you an eyewitness account of a broken healthcare system where profit always comes before patient care. I'm a retired dental hygienist, and I still have nightmares of my experience of always being behind the 8 ball when trying to balance patient care with the, quote, productivity, unquote, protocols of the offices I worked in. The very first one I worked in was the most egregious. It was a large HMO office where time spent per patient was determined by how much money the company could receive per patient. All the hygienists and dentists were constantly trying to catch up while trying our very best to fulfill our ethical and professional responsibilities. We were always late, especially when trying to catch up after patient lateness. And as a result, patients were commonly upset. Most of the hygienists and dentists were fresh out of school, which of course added to the profitability of the company as we were paid less than more experienced people. The turnover was humongous. Once people got their experience, they quickly moved on like I did. An example of patients suffering in this system was that the rush dentist, an inexperienced dentist would often miss their marks when trying to give a mandibular block, which is to anesthetize for the lower teeth before treatment. This would cause Bell's palsy, which caused twitching and freezing of one whole side of the patient's face, including the eye. We commonly had to reassure the patients that this would wear off within hours. The underlying factor that led to all this dysfunction was insurance company coverage determining time spent per patient. The only patients that ended up happy in this situation were those with excellent or at least good oral hygiene, as they needed the least time. The average patient suffered and complained often. Under Medicare for All, a single-payer system, dental care will finally be covered. No copay, no deductible. So many people forgo or delay necessary dental care because they cannot afford coverage. Please join us to fix this broken system. Please support Bills 109, 230, 233, and S49. Thank you for the opportunity to share my story.
Any questions for Catherine from the committee? Thank you for calling in.
Thank you.
We're going to attempt to get one of the Praveen is going to be the next person we hear from. Praveen Rajaguru. Praveen?
Hello?
Praveen?
Hello?
Yes, go right ahead. Is this Praveen?
Yep, my name is Praveen Rajaguru. I'm a medical student at Alpert Medical School supporting bills S49, 109, 230, 233, and 379. And I have not submitted any written testimony.
Okay.
In addition to the extensive testimony, very heartfelt and very true that's been given before, I would like to just ask our legislators to consider who is benefiting from the role of private insurance in Rhode Island healthcare, especially when it comes to quote-unquote managing Medicaid, with $1.7 billion annually being provided for these purposes. This is especially true during the pandemic. As a medical student at the Providence Community Health Center, it was heartbreaking to see many patients having to delay care due to COVID. There were several who noted difficulty in getting their medications and accessing care because of COVID. Many were parents with young children and dependents, and a few noted that they've been forced to jump from job to job because of the economic struggles in Rhode Island. Seeing those encounters got me to do some digging, and it turns out that unemployment in Rhode Island was 8.1% in December 2020, which was more than double that of December 2019. A recent Commonwealth Fund survey found that 40% of respondents had lost a job and were at risk of losing their insurance. It turns out that non-COVID admissions are down across the nation, especially among people of color. and people are losing insurance and using less healthcare. So it seems like patients and users of healthcare are losing during the pandemic. Physicians are also seeing fewer patients, and a recent survey found that 62% have seen their income drop during the pandemic. Employment in healthcare dropped by over 1 million during the first few months of the pandemic, and hospitals were projected to lose over 300 million during 2020. So it also seems like providers are losing during the pandemic. So if patients and users of healthcare are losing during the pandemic, and providers are also losing during the pandemic, it just begs the consideration of who is actually winning. And the only group that's winning are private insurers. And those are those who make a profit off of denying care and in many instances literally lose money when healthcare is provided. One of the MCOs that would be audited under Bill S49 would be United Health. United Health's net income during the second quarter grew from $3.4 billion in 2019 to $6.7 billion in 2020. So they are thriving, and their profits have doubled in 2020, and they're not being audited in the state of Rhode Island for how they're managing, quote-unquote, managing their Medicaid plans. So how are these companies making so much money while literally everyone else is losing, and how can we allow this to keep happening? I think in addition to everything that's been shared before, that's why I'm in support of all the aforementioned bills as a first step in addressing this inequity. Thank you.
So Praveen, can I ask you a question just so we can?
Of course.
Are you part of the Brown Medical Students for National Health program?
Yes.
And also Neha and Robert are part of the same group, and I think Neha is already gone to work. Is that right? If you know.
Neha and Rob, I don't know.
Rob is on the call next. I think Rob's on the call next, but Neha seems to have already gone to work. Is that just to?
Oh, she's still available.
She's still available? We'll try her again.
She's still available, yeah.
Okay. Mm-hmm. Okay.
Great. Thank you so much.
Any questions for Praveen? Thank you for calling in.
Mm-hmm. Thank you. Take care.
Yep. Next is Robert Fain. Robert? Robert?
Hello.
Go right ahead.
Okay, thank you. My name is Robert Fain. I am a third-year medical student at Brown University and a co-organizer for Brown's chapter of Students for a National Health Program. Greetings, honored state legislators. I wish I could be here in person, but I'm speaking here today in support of Bills S49, S109, S230, and S233. Like many Americans, I grew up with the notion that we had the best healthcare system in the world. As I embarked on my medical career, however, I began to realize this was far from the truth. While traveling through the UK, friends who were from Europe said that they were sorry that I had to experience life in the U.S. healthcare system, and I consider myself one of the lucky ones. Our system segregates quality of care based on people's insurance status, ability to pay, and citizenship status. The costs are high, and there's an unfair distribution of resources, and it forces resources like safety net hospitals to close, including Memorial Hospital in Pawtucket. I was at a clinic next door to the ruins of Memorial Hospital when I met a patient with worsening hypertension and diabetes who hadn't refilled his essential medications because he could not afford them. And I've also seen people with possible COVID infections afraid to get tested because the fear of taking off work could risk them losing their jobs and their health insurance. These are just a few examples of how broken our system is. And I don't want to work as a doctor in a system that does daily harm in the name of raising profits for insurance company stakeholders. What I want is to work towards reducing health inequities brought on by racial and socioeconomic injustice. I hope you will join me in building this future by fighting for Medicare for all, improved single-payer Medicare for all is straightforward and simple, whereas our current fragmented private system is ridiculously complex. Single-payer health care eliminates premiums, deductibles, and copays, and it ensures universal coverage regardless of employment, and it works to address systemic racism. It's publicly funded and privately provided, and it will reduce costs and save lives. A 2020 article by The Lancet and Yale University economists estimated that enacting a single-payer system in the U.S. now would save 68,000 lives annually. 68,000 lives is enormous, and it goes beyond any kind of policy question. In medicine, we pride ourselves on making decisions based on evidence. And to me, the evidence could not be clearer. Single-payer healthcare can help fix our broken system. Almost every other developed country has figured this out. Why can't we? I urge you to have the courage to stand up to the insurance and pharmaceutical lobbyists and fight for healthcare justice in Rhode Island and in our nation. Thank you.
Any questions for Robert? Thank you for calling in.
Thank you.
Next, we'll try Neha Reddy, also from Brown Medical School. Neha, you're on with the committee.
Hello?
You're on with the committee. Go right ahead.
Oh, hi everyone. My name is Neha Reddy. I haven't submitted written testimony tonight, and I'm here to support all 5 of the healthcare bills.
Right ahead.
Okay. So my name is Neha Reddy. I'm a second-year medical student at Halper Medical School of Brown University. I'm here today to express support for Bills S-233, 230, 109, 49, and 379. Because as a future doctor, I'm concerned about the adverse effects of health insurance costs on patients and the inability to adequately care for historically marginalized communities due to our lack of affordable, comprehensive coverage that only Medicare for All can achieve. I support the first bill on today's agenda, S-49, because we cannot keep cutting Medicaid funding without knowing the true costs of private insurers that are managing Medicaid. Implementing an audit is the best way to evaluate health insurance companies and to ensure that MCOs are providing quality, affordable care, similar to the precedent set by other states. I strongly support the other bills advocating for a state or federal single-payer Medicare for All program because patients are too often denied medical coverage by their health insurance companies for arbitrary reasons, and patients who lack insurance altogether must visit free clinics that work so hard to support these communities or the emergency department for any form of medical treatment. I've seen and heard of people harmed by a system in which they are forced to put off treatment until an emergency arises or who cannot afford to pay for their medications. This adversely impacts people of color and immigrant communities the most, heightening racial health disparities in Rhode Island and nationwide. As a future doctor, I don't want to work in a system that is profit and quota driven. COVID-19, which has shined a light on many of these inequities, offers us all a moment to pause and act to control private insurance companies, remove middlemen, and bring to fruition the motto of healthcare as a right for all people. Even if the U.S. as a whole won't act right now, Rhode Island can. Thank you.
Any questions? I want to thank all 3 of you for calling in, and we'll go next to Christopher Hill. Christopher?
Yeah.
Go right ahead. You're on with Senate Health and Human Services. Let us know what bill you're testifying on and whether you have any written testimony.
I just wanted to say that I really think that Medicare for All is really important. That people are suffering a lot from having access to health insurance. I know it's been a huge hurdle for me to try and before I qualified for Medicare to be able to feel like I could get the services that I needed, and I just want to express my support for it. So, yeah, thank you.
Any questions for Christopher? Thank you very much for calling in.
Okay, thanks. Bye.
Okay. Next person we're going to try to get to speak to us is Dr. Coral Keith. Dr. Keith?
Hello?
Dr. Keith?
Yes, hello, this is Keith Coral.
Yeah, go right ahead and tell us what bill you're testifying on behalf of and whether you've submitted any written testimony.
No, I haven't submitted any written testimony.
Okay.
I am calling in support of S49, 109, 233, 230, and 379. I'm a ER and ICU doctor working here at Rhode Island, and I've been working for approximately 15 years. I work in the medical ICU and have been taking care of all the critically ill COVID patients that have come through our system. And, you know, these bills are so important because on a daily basis, I have seen the pain and suffering that our system inflicts upon, you know, our fellow citizens. And, you know, it was a problem before COVID. We see it with the untreated conditions, the high blood pressure, the diabetes that leads to poor outcomes and death secondary to COVID in the ICU. But before COVID, I worked as an ER doctor up at Memorial Hospital and in the emergency room. And many people know that hospital had to close. And, you know, one of the reasons was it didn't have a good payer mix, and it supported a lovely community, and it was a joy as a provider to work there. It was an underserved community. It was a minority community. Patients were very appreciative just to have somebody sit down, listen to them, and take their health concerns seriously. And I remember this one patient that I cared for not too long ago. It was a young woman, a mother of two, who came in one evening. I was working, and she had fallen down. She told the nurse she fell down. She came in. She had a cut lip, an abrasion to her face, bruising around her eyes. And I got to spend a bit of time with her because she needed the laceration on her face fixed, and it took a bit of time, and just something wasn't right. And as we got to talking, I think she became more comfortable, and she confided in me that, you know, she hadn't fallen down, and of course, like, she was a victim of abuse. Her significant other, had assaulted her, but she didn't want to tell anybody because he was the source of her income, and she was afraid about the medical bill. And she told me that the last time that she had told an authority, the police, that he was, assaulting her, he went away to prison for a short period of time. And during that time, she was homeless, and she lived out of her van with her two kids. And she told me that they drove up and down I-95 and found a different place to sleep every night. And so that night, I was not able to. I was able to fix her lacerations and fix her wounds, but she didn't report that assault to the police, and she left the emergency department with a pamphlet. And I think about how we failed her often, and we're the richest country in the world, and we ought to do better, and we can do better. I think it's just a matter, do we want to? So, thank you for your time.
Any questions for Dr. Keith? I want to thank you. That was incredibly valuable testimony to the committee. And thank you for taking the time to testify.
Thank you.
Yep. Next person we're going to try to connect to testify is Daniel Crowell. Mr. Crowell? Mr. Crowell?
Yes.
You're on with the committee. Go right ahead with your testimony. Let us know what bill you're testifying on and whether you submitted anything in writing.
Yes, I'm testifying on the Senate single-payer health care bill.
Okay.
I want to just speak strongly in favor of creating a single-payer health care system in Rhode Island. The current system where insurance is provided through employers is really just not a way that makes sense of doing things. I'm on Medicaid now, and I know that if I get another job, that then could be on a different insurance plan that has different types of coverage, maybe not as good. Also, just from my experience with psychiatric hospitals, I've seen friends of mine who have insurance coverage, but the insurance won't cover them for the full stay of treatment. So after 3 weeks, they'll get kicked out of treatment just because the insurance company doesn't want to cover the costs. And then the therapists at the hospital will spend enormous amounts of time just arguing with insurance agents, basically over the phone. So that would just be one of many examples of how this current system doesn't work. I think creating a single-payer healthcare system in Rhode Island is perfectly feasible if there's the political will to do it. The first single-payer healthcare system in Canada was created in Saskatchewan, which has about the same population, I believe, as Rhode Island. So it's something that we can do, and I really hope that it happens in the next, as soon as possible.
Any questions for Mr. Crowell? If not, I want to thank you for calling in.
Okay, thank you.
Yep. Next person we're going to try to connect to testify is Daniel Denver. Mr. Denver?
Yes.
Go right ahead. You're on with the committee.
All right. Thank you very much for your time. It's good to be with you, albeit virtually. My name is Daniel Denver, and I am a co-chair of Reclaim Rhode Island, a grassroots organization organizing people across the ocean state to fight for social and economic justice. This has been a tough year. We as Americans are brought up to believe that we belong to an exceptional nation. But over the last year, it's become really clear to many, many people that our government is exceptionally terrible at taking care of our people. Trump's contributions are pretty monstrous but pretty obvious. But the pandemic has also made it clear that a lot of our problems precede Trump. The inequality, the poverty, the segregation, the corporate power that we see running amok from Uber to Amazon, and of course the healthcare situation. We live in the wealthiest nation in the world's history, but the wealth is controlled by a very small minority. As a result, the majority scrape by as they can. Obamacare did not fix this. Not only do many people still lack health insurance,
Dan, are you still there? We'll try to reconnect him. What's the next person, Dennis? While we're trying to reconnect with him, we'll put Dennis Hogan. We'll try to connect with Dennis Hogan. Dennis?
Yes.
Go right ahead with your testimony for Senate Health. Let us know what bill you're testifying on and whether you also submitted anything in writing.
Yes, I have not submitted any written testimony. I'm testifying on Senate Bill 233.
Okay. Go right ahead.
I'm testifying in favor of the bill. I live in Wayland Square. I'm a constituent of Senator Golden, so I just wanted to first thank Senator Golden for her sponsorship of this really important legislation. I know that senators, you've heard a lot of important testimony today, and I know you'll be hearing much more when I'm done. But I just wanted to share a story about what it's like to have really good health care from your employer.
I am employed by Brown University, and I'm a graduate student there, and we have pretty good health insurance. But a few years ago, the university decided to switch the health coverage that we were signed up for. This happened over the summer. A lot of folks, left at the end of one academic year, came back to find that they had their health plan switched. Folks weren't consulted about that decision, and there was no study undertaken to see, whether the new healthcare plan would actually be better at meeting the needs that people had. And for some folks, in fact, it was. Some of their costs went down or providers came into network, but for lots of other people, cost of prescriptions went up, doctors that they developed relationships with went out of network. And this all happened in a way that was really sudden, really confusing, and made folks feel like they, in an area of their lives where they wanted to have, as much ability to make decisions as possible, it was another decision that was taken away from them. The reason I know this is because it turned out that we were organizing a union at the same time. And so we were having hundreds of conversations with folks, and this came up again and again. And so, it turned out that a big part of the work that we were doing was just helping people to navigate the system or get answers about how their coverage or their ability to get health care would change. And again, it was something that people mentioned as, another worry. So I tell this story really just to indicate that having insurance through your employer is yet another way that employers have a lot of power over employees and are able to unilaterally make decisions that could literally be life or death for them. And so while we need comprehensive health care coverage, especially for folks who don't have it, folks who already have it stand to benefit in enormous ways as well. Thanks so much for hearing my testimony, and thank you to all for your time. I encourage you to support the bill, and I hope that it will come before the full Senate.
Any questions for Mr. Hogan? Thank you for calling in. Next, we'll try to reconnect with Daniel Denver. Dan? Sorry we lost you there. You can continue.
Oh, that's all right. I'll just pick up where I left off. Apologies for the call dropping. Obamacare did not fix our health care problems, obviously. Not only do many people still lack health insurance entirely, many more are underinsured or must pay extreme premiums, deductibles, and copays, experiences that I'm sure people on the committee are either personally experienced with or have family members or friends who have experienced. People go bankrupt and even die because we treat health care as a commodity to be profited from rather than a very basic service that any decent government should be expected to provide to the people. We really can't tinker at the edges of the private health insurance oligopoly. We have got to take the profit motive out of health care, out of health insurance. Medicare for all, single-payer health care is quite clearly the only way forward. And Rhode Island should not wait on the federal government to make it happen. We can and should lead. Our little roadie could and should be a laboratory for a better America that the pandemic has shown us we all need and deserve. So I urge legislators to move towards single payer in Rhode Island now and to push for our congressional delegation to advocate for Medicare for all in Washington. Thanks very, very much for your time.
Any questions for Mr. Denver? Thanks for calling in and all the organizing you do out in the community.
Many thanks for your time, and apologies for the call dropping earlier. Have a nice evening.
Yep. Next, we'll try to connect to testify is Doug Taylor. Mr. Taylor?
Hey, how are you?
Go right ahead and just let us know what bill you're interested in testifying on and whether you have any written testimony.
So I don't have any written testimony, and I am calling to testify in support of 0233.
Okay.
I'm just going to keep it quick. Someone I love very much has a chronic illness diagnosis. She's got lupus and chronic migraines, and it's one of those things that you have to adapt to. But the financial toll and stress of navigating a healthcare system whose priority is their bottom line versus taking care of people has been one of the hugest hurdles in how we learn to live with these diagnoses. For a condition that's best managed by minimizing stress, trying to pitch to an insurance company that they need to cover your treatment is the last thing you should be doing. I've seen friends delay care until their teeth were rotting out of their head. They'd rather wait until the absolute last minute before taking on another bill. At the end of the day, we're in historic plague and economic contraction. People are afraid of getting sick if they're not sick already. They're afraid of losing their jobs and insurance if they haven't lost them already. And our system is so broken that GoFundMe is the de facto social safety net. It's clear that we can't keep kicking the can down the road, and something's got to change. So I really, really hope that you guys can get this passed. Being able to offer a new paradigm in healthcare would help so many people. Another world is possible. Thanks.
Any questions for Mr. Taylor? Thank you for calling in.
Thank you.
Next, we're going to try to connect with Emily Harrington for her testimony. Ms. Harrington?
Hi.
Hi. Go right ahead. You're on with the committee. Just let us know what bill you want to testify on and whether you submitted anything in writing.
You bet. I haven't submitted anything in writing.
Okay.
I'd like to testify in support of bills S233, 49, 109, and 230.
Okay.
So my name is Emily. I'm a Providence resident from Rhode Island originally. I've been working in the service industry since I finished college, so I've never had the option of employer-based coverage. I've been lucky enough to have been able to stay on my parents' health insurance until last April when I turned 26, but it almost felt like a joke when a month before losing that coverage, we entered this COVID crisis, and I, like so many other people, was suddenly not only uninsured due to my age, but also jobless, with no hope really of going back to those restaurants in the foreseeable future at that point. The COBRA literature I received prior to losing that coverage made it pretty clear that even if I hadn't lost my job, I'd be unable to afford insurance, so I decided to lean on my good health and take the risk that 40,000 other Rhode Islanders also take of living and working without health insurance. I've tried many times over the course of the last year to attain health insurance through the ACA Marketplace and through HealthSource RI, but the cost, even now that I'm back to working full-time, is still prohibitive. On one early phone call, when I was quoted a rate for high-deductible, high-premium health insurance, I asked the agent, what could I do? What other information did he need to prove that I was eligible to receive the human right of health care at a cost that I could afford? It must have been the end of his shift because he scoffed and said, I don't know what you want me to do. Do you want me to pay for it? I said no and was kind of upset and hung up, but I've continued to live without health insurance, but that interaction really stuck with me. I don't want that grumpy insurance agent to pay my private premiums, and I don't want to depend on an employer or spouse to receive health care. I, like everyone testifying here and all of the senators who are in support of these bills, want our country, the richest in the world's history and the quote-unquote most advanced healthcare system in the world, to provide single-payer health coverage to everyone in the U.S., ideally regardless of income or employment or immigration status. And so I thank you all for your time. I really think that Rhode Island, with our small but incredibly diverse and creative and hardworking population, could really play a historic role in getting us closer to a just system of Medicare for all, and I urge our legislators to take on this important work of providing single-payer health care to Rhode Islanders. So thanks so much for your time and consideration. Thanks.
Any questions for Emily? Thank you for calling in. Next, we'll try to connect with Enrique Sanchez. Mr. Sanchez?
Oh, how are you doing? Thank you for having me here.
Oh, thanks for calling in.
Thank you. Yep. My name is Enrique Sanchez, and I'm here representing the BLM RI PAC and the Providence DSA, Democratic Socialists of America. I am here in support of S233 as a person of color, working as a person belonging to the working class. I have seen firsthand the devastation that this pandemic has caused to working people and working class people and working poor people and marginalized communities throughout Rhode Island and especially here in Providence. I work in education. I'm a long-term substitute teacher at Mount Pleasant High School, where I see firsthand the implications of not having a Medicare for All platform that provides single-payer health care for marginalized communities. I see firsthand things like private capital-funded programs like the Smart Clinic that the new Rhode Island Department of Education Commissioner and Superintendent have implemented into Providence public schools with the intention of trying to help black and brown and white people, young black and brown and white folks, students with this sort of Smart Clinic initiative where they ask for some sort of insurance ID to these students, and they also ask for insurance IDs to for educators, teachers, and school faculty. I find that to be very disgusting, in my opinion. Private capital, like Smart Clinics, should not be in on public school grounds. And I believe that those are the first steps of privatization of the only public institutions that we have left. I want to redirect my attention to our federal senators and federal representatives who have not done enough to make sure that Rhode Islanders hear their voices out on getting Medicare for all. They have prioritized military funding for defense budget bills. I cannot believe that we had a $800 billion defense budget passed in the middle of the pandemic. 500,000 plus Americans have died due to this pandemic. If we would have had Medicare for all, those numbers would have probably been a lot more lower. As Rhode Islanders, there are a lot of people who have died and have been left out with any type of coverage, and have always been denied. It's time that, as working people and poor people and people of color, we start advocating more for our own well-being, our health being. Now that we have seen that a lot of our politicians have failed us, have left us to suffer at the hands of poverty, destruction, and homelessness. We are the richest country, like a lot of people have mentioned on this call. We are the richest country, one of the richest countries in history, and we do not provide this type of service. I find that unacceptable. We prioritize military defense budget spending here and abroad. We prioritize bailing out Wall Street. We prioritize not giving taxes to big major corporations like Amazon and Microsoft, etc. And our pharmaceutical companies, insurance companies are all in control of our public servants, politicians at the local, state, and national level, and we need to start reversing that back. Our politicians need to be in charge, need to be leading the way, not vice versa. And all I can say is that better times are coming. People are waking up. People are going to run for office who represent working poor people, working class people, and I do see a brighter future for the United States where the people are in control and private corporations and private donors and rich people are not in control. Thank you for your time.
Any questions for Mr. Sanchez? Senator Bell has a question for you.
Thank you so much, Mr. Sanchez. And I just want to take this opportunity to thank the educators at our neighborhood high school for all you've done to advocate for healthcare for the students at Mount Pleasant High. And really what we're talking about is for keeping a single payer system where we have school nurses that you can see for free without having to deal with health insurance. And so I think it's a really good example of how important a single payer system is. And I really just want to thank all the teachers at Mount Pleasant High who've spoken up so strongly for keeping these really essential services for the students of our neighborhood high school.
Any other questions for Mr. Sanchez? Thank you for calling in.
Thank you.
Yep. Next, we're going to try to connect for testimony with Erica Munoz. Ms. Munoz?
Yes.
Go right ahead. You're in front of the committee. Let us know what bill you're testifying on.
I'm testifying for Medicare for all.
Okay, go right ahead.
I think it's a good idea to have all of our citizens healthy. I think there is always money in the budget. We just need to allocate it. And that's pretty much it. I support everyone being healthy.
Thank you for calling in. Any questions for the committee? Thank you.
Thank you.
Yep. Next, we're going to try to connect with Fernanda Poyan. Fernanda? Fernanda? Hello?
Hello.
Fernanda, you're on with the committee if you wish to testify, and let us know what bill.
I'd like to testify for Bill 109 and 233 on Medicare for all.
Okay, go right ahead.
So my name is Fernanda. I'm a resident of Providence, Rhode Island. I'm a mother of 3, social worker, and I just think it's crazy that me and my husband, we pay so much money into our health insurance, and still every visit we have with our children, we get hit with co-pays, and it just really becomes unmanageable in that, you have to think about your family in terms of financial terms. And I really think it's sad that, healthcare should be a human, basic human needs, but in this country it's kind of feels like a way to make money. And, we've heard tonight some providers, like nobody likes this system. It's failing the people that it's designed to work for. Providers don't like to work under the system. So I think that we definitely need to have some sort of Medicare for all. People get stuck in jobs they don't want because, they need that health insurance that's tied to their job. And I think that also prevents small business people from starting their own business. So if you want to help the economy, having people not attach their health insurance with their jobs, that could help, stimulate the economy and open new businesses. And the other part of it is, as a social worker, I work with a lot of clients that are experiencing opioid use disorders, and a lot of the times they're turned down because lack of insurance, and it's just discouraging. We lose so many people over not having access to health care, and it's just, I think that we are a small state. We can set an example for the rest of the country. I think all around it's just a good idea that we should be really considering.
Thank you. Any questions for Fernanda on the committee? Thank you for calling in.
All right, thank you.
Yep. Next, we're going to try to connect for testimony with Jeanine Edwards. Ms. Edwards,
Yes, hello.
go right ahead. You're on with the committee. Let us know what bill you're testifying on.
Well, I actually sent in written testimony for 3 out of 4 of them. I sent in on 0230 and also 0109, the national one, and also 233 for the, I think that's the, that's the one for within the state of Rhode Island.
Yep.
So I'm going to read aloud what I wrote for.
Ask you to do us a favor and not read your written, just paraphrase each one for us. Yeah.
Okay, they're all very similar. I mean, you know, I'm almost 60 years old, and I remember when doctors still made house calls and only earned about twice as much as my father, and so providing medical health for an entire family was not a big deal, but that is not the case. Right now, it is a huge big deal, not only financially, which the burden of which goes on to employers, but also just logistically. So, you know, in today's world, we change jobs a lot. Well, not only do we change jobs a lot, we move around a lot. We don't even live in the same state anymore. We move, especially here in the Northeast, where states like Rhode Island are small. We live in one place, we work in another. And I have 2 daughters who are in their 20s who tell me that these days people change jobs every 2 or 3 years. It's completely ridiculous. And even if you have a fairly stable career and you stay in the same job for 7 years or 14 years, which tends to be the pattern for me and for my husband, you know, your employer changes insurance plans, or your doctor moves or retires or discontinues your insurance plan because it doesn't pay him enough. So, and then we have FSAs and HSAs, which are like a logistical nightmare to try to administer as an individual person. So I feel like I have not gotten very good health care. There's no continuity in my health care. I've had Lyme disease and, you know, other conditions that doctors don't know about because nobody has access to my old records, the burden of which is upon me to produce. So I'm like a middle-class white lady who can't wait for us to implement Medicare for all.
Thank you.
Is that enough?
That's great. And we'll look for your written testimony.
Okay, I sent 3 emails yesterday before 11 a.m.
Yeah,
and they all basically tell the same story with minor modifications.
Right. We'll make sure to find those, and thank you for not reading each and every one of those to us so we can get to the rest of our long list.
Yes. Okay, good luck. Thank you very much for your work.
You're welcome. Thank you.
Bye-bye.
Bye. Next person we're going to try to connect with for testimony is Grace Zhang.
Hi, I'm here.
Grace?
Hello?
Yes,
Yeah,
go right
hi.
ahead. You're on with the committee. Let us know what bill you're interested in testifying on and whether you submitted any written testimony.
No written testimony.
Okay.
I'm calling in to support Senate Bills 109 and 233. When I was 7 years old, I fractured my skull. It was a freak accident, and I'm lucky that my father had health insurance through work, because otherwise there's a good chance that I wouldn't be here right now. But even at 7 years old, I heard my parents talking about the bills, and I know that the health care that I received then was incredibly expensive for us. Right now, I receive treatment for my mental health to just be able to function normally. And again, I consider myself incredibly lucky that my family can afford it. But I'm turning 26 next year, and I'll lose coverage. And it's already taken me years to finally feel like I've made enough progress to even just be on this call right now. I know that I'm still like at the beginning stages of my treatment process, and I have a lot longer to go. And I don't know how I'm going to be able to afford it after next year. I don't think anyone should have to reconcile between receiving life-saving health care and potentially bankrupting themselves or their families. Especially now during this pandemic, it's an incredible injustice that people can't access care that they need, especially because it's low-income working people who are overwhelmingly exposed to COVID. We need Medicare for all, and we've needed it for a long time, frankly. Thank you.
Any questions for Grace? Thank you for calling in.
Thank you.
Yep. Next person we're going to try to connect with is Gregory Greco. Mr. Greco?
Yes.
Go right ahead. Just let
thank
us
you
know
very much. My name is Gregory Greco. I am a resident of East Providence and a constituent of the main sponsor of Senate Bill 0230, Cynthia Mendes. This is the Medicare for All study resolution, and I'm going to start by providing a few statistics. The first is that the United States, according to the last World Health Organization rankings for the best health systems in the world, ranked 37th, in between Costa Rica and Slovenia, as well as according to Peterson Kaiser Family Foundation study last year, we spend more than twice as much per capita on healthcare than any other country in the world, with the exception of Switzerland and Germany, where we spend 42% and 65% more than they do. So the reality is our healthcare system is profoundly inefficient. I'm going to give one example of that. So a couple years ago, I got blood drawn. I went in, sat down for 5 minutes, got my blood drawn. They sent it to a lab, took it around, and in about 24 hours, I got my results. However, a couple weeks later, I got a bill for $300 because one of my 9 different tests that was asked for was not covered by insurance. So I was like, this is crazy. How could $300 be for just one test out of 9? And then I asked, well, how much does the overall 9 test cost? And it was like $2,300 for me to go in for 5 minutes, get my blood drawn, then take it to a lab, and in a few hours get the results. We have to have a better way. I understand that Rhode Island is not the United States and that it makes things a little bit more complex, but we are essentially doing the least efficient thing we could possibly do with healthcare, and it's killing millions of people in this country through medical debt, through inefficient healthcare services, through the only system in the world where millions of people are without health care. The other thing I forgot to mention is out of the 36 countries that have ranked ahead of us in the World Health Organization, every single one of them has universal health care. We are the only country that does not, and most of them have health care that's provided by the country. So it is absolutely insane that we are continuing to do this, and I really applaud Senator Mendes for taking the first stance as Rhode Island in doing something sane, doing something, a policy that's going to work for the majority of people. And I thank you all for your time. Thank you very much. Take care.
Any questions for Mr. Greco? Thank you for calling in. Okay. Dr. Ryan?
Thank you very much.
Yes. You're on with the committee. Can you turn down your feed so we don't get the...
Let me do that right now. I've been trying to follow along with the proceedings as they occur, so let me turn you off on the computer and turn you on the okay, is that better?
Yes.
Fantastic. Okay, so
as
my name is...
As you've heard me ask people to identify what bill they're testifying on before they testify.
And whether I've submitted written testimony.
Right.
Yes. So my name is Mark Ryan. I'm a physician who's been practicing in Rhode Island for about 30 years or so. I'm testifying tonight in support of 5 bills: S49, the MCO audit, S109, to urge our federal delegates to support Medicare for All, S230 to undertake a state study about feasibility of Medicare for All, S233 to actually start the process of applying for a federal waiver to be able to implement single payer, and S379, which advocates Medicaid de-privatization. To put S49 and S379 together, I know others have testified about this, but I just wanted to point out that we, under Governor Raimondo, we have tried the so-called Medicaid Reinvention program, which did cut Medicaid funding, but without actually studying where the cuts were going to come. Shortly after these cuts occurred, Memorial Hospital went out of business. I think if we're going to consider further cuts to Medicaid funding, we need to figure out where the money is going. And since we have never audited the private insurance companies that act as Medicaid managers, it is high time that we do that. As far as the other studies are concerned, the S109 is really to just urge all 4 of our federal delegates to support Medicare for All. 3 of them have already signed on as sponsors to Medicare for All legislation. Senator Reid has not. I believe it is up to the state to urge Senator Reid, as well as his colleagues, to actually take action to try to bring this about. Our health system is in crisis, and we are rapidly running out of time to do something about it. As far as the other 2, I would like to start just with a very short story. Every time I come and testify before this and other committees about this issue, I always have stories because, unfortunately, every week at work I am seeing examples of how people are just being basically killed by the way we fund health care. The most recent atrocity occurred on Tuesday when I was precepting at the residence clinic at the Merriam Hospital. There was a lady who came in for follow-up on her various medical problems. She was diabetic, hypertensive, had just lost her job. And the reason why she did, she had fallen 4 weeks earlier and actually fractured her right hip socket, the acetabulum. She was able to bear weight, but could not walk very well. She normally was ambulatory, but here she came in a wheelchair. She can walk short distances on crutches, and she can no longer work at her job. She was seen by an orthopedic surgeon in the emergency room who told her she would need a hip replacement. Unfortunately, with her insurance, there's a $2,000 deductible that has to be met before the insurance even starts to pay for the treatment she needs, for the surgical procedure she needs. She has not got $2,000. And as a result, her diabetes is now completely out of control. Her blood pressure is elevated. She can't eat properly. She can't exercise. And now she's going to lose her job. Eventually, I hope, she'll wind up on Medicaid, at which point, hopefully, she can get her surgery done. But in the meantime, her health is being really badly affected. And it really is all because of her insurance that insists on this so-called cost sharing, which is really nothing more than providing an enormous financial barrier to care. And this, unfortunately, is what insurance companies do. As others have already pointed out, in this year, hospitals are seeing huge deficits. That is part of the reason, in fact, most of the reason, why Care New England and Lifespan are being forced into each other's arms. It is the reason why Roger Williams and Fatima Hospital have had to be sold to a for-profit entity from Southern California, Charter Care. It is the reason why Westerly Hospital is now owned by Yale New Haven Medical Center. And in this year where actual providers of care are losing money hand over fist, the insurance companies are racking up record profits. Now, according to a New York Times article, profits for United Healthcare are up by 100%. They're up by almost as large numbers with other insurers. And yet, despite this record profit-making, both United Healthcare and Blue Cross petitioned our Office of Health Insurance Commissioner to be allowed to raise their rates, a request that was granted. So we see by this incredibly greedy and very selfish action by our state insurance companies that their concern is entirely directed towards their own financial self-interest and not at all towards the well-being of anyone else in the state. When you have financial institutions that control how money is being supplied to provide health care, who clearly have an active disinterest in making sure that that care is provided, you have a system that has got to be stopped. We have had numerous national studies, and I would direct your attention to the studies submitted by Professor Gerald Friedman from the University of Massachusetts, looking at Rhode Island and how a single-payer system would be feasible within this state, which is what the S-230, the state study, as well as S-233, to start seeking a waiver, would help to accomplish. Every study that has been looked at this, including one that was actually funded by the Koch brothers, showed that a Medicare for All program instituted nationally would save the country money. So we have a system that is no longer affordable for individuals like the lady I saw with the hip fracture. It is not affordable for our country. We pay the highest rates per capita for health care despite having the lowest life expectancy of most industrialized countries, despite having a population that seeks care less frequently than any European nation, that utilizes health care less than people of any European nation. So utilization, which we're frequently being told is the reason for our health costs, is not the reason. The reason is insurance company overhead and incredibly high pharmaceutical company profits. Drug prices that Americans pay are 60% at least higher than are paid by any other group of people in the world. Medicare, which could actually effectively negotiate lower prices, is forbidden by law to do so, a law that, of course, was sponsored through with money supplied by the pharmaceutical industry. We really need to start looking at this problem objectively, try to figure out how to run a healthcare system that is actually going to work, is actually going to provide people with the care that they need, and is not going to be forever beholden to the financial interests of the pharmaceutical and insurance industries. I thank you very much for the opportunity to speak, and I look forward to your action on all 5 of these bills. Thank you, Senator Miller. Thank you very much to the committee.
Dr. Ryan, that UMass study that you mentioned, is that in your written testimony, a reference to that?
Well, it's not my testimony. Professor Fried, we submitted it on behalf of Professor Friedman. You should have the study.
Okay, thank you. Any other questions? Senator Calkin?
Thank you, Mr. Chair. Dr. Ryan, I just wanted to thank you for your years of tireless work trying to promote single payer here in Rhode Island and nationally. One thing that I did want to confirm is not necessarily knocking doors, but like talking to folks over the last few years, especially in this past year with COVID. So many people told me about how even with their insurance through their employer, how expensive it is. You know, they're paying, $10,000 a year just for their premium share. And then they have $2,000, $3,000, $4,000 worth of deductibles. Then you add copays on top of that. So the amount of people that tell me how difficult and how they're avoiding going to the doctor just because they can't afford the cost sharing has really been brought up even more frequently than it was in the past. So, thank you for mentioning that. And I'm sure, in your practice, you have probably seen that happen as well.
Yeah, thank you, Senator Calkin. No, unfortunately, what you're saying is absolutely right. National data support this. It's estimated that effectively, 50,000 people in this country die every year because they are uninsured, and it is unclear, but we know the number is actually higher for people who have underinsurance, people who have to spend at least 10% of their income on their health care. It's the number one cause of personal bankruptcy in this country. That is not true in any other industrialized nation. No other industrialized nation has a statistic of people who die because they have no access to health care. These problems don't occur in other industrialized countries, and the only reason they occur in the United States is because we insist on continuing this obscenely ineffective and predatory system of private health insurance. There is zero good reason to continue the system, and there are humanitarian, economic, and just logical reasons why we need to jettison it immediately.
Senator Bell?
Thank you so much, Chairman. And I really want to thank you, Dr. Ryan, for the years of work you put in on this cause, on this legislation, all the insight you've given in crafting it. I wanted to ask you a question about in your role as a member of Portsmouth Town Council. And I'm wondering if you can comment, as we sort of discussed, the chairman touched on it briefly earlier, but I'm wondering if you can comment on the impact this legislation would have on your town's future finances and specifically ability to pay OPEB costs.
Well, I didn't mention that, Senator Bell, and I thank you very much for bringing that up. This is a perennial club with which our local Tea Party beats us over the head. OPEB costs, other post-employment benefit, in other words, the cost of private health insurance that we have to pay for town employees between the time that they retire and the time that they qualify for Medicare. It's a very high number. It weighs down on our ability to pay for other necessary town services. And of course, if Medicare is universal, there is no OPEB. If you have people who are covered cradle to grave with health insurance that's paid for equitably, I might add, the way we pay for it now is through premiums. And again, the CEO of a company pays the same premium as the janitor who cleans out his office. With a single payer system, the premiums are proportional to the person's income. They're paid for in most models with a combination of income tax and payroll taxes, which in most cases would be lower than most companies are paying now. So with that system in place and with universal health insurance in place, OPEB pretty much goes away. We don't have to worry about it. I would also add, and this sounds very selfish coming from a physician, this also to a great degree alleviates the massive settlements in medical malpractice cases, because a large part of the settlement is generally devoted to the medical care that is going to be required by the person who's been injured. And I know this sounds incredibly selfish, but again, if you have people who are already automatically being cared for, no matter what injury they've sustained, then the reason for lawsuits is much less. So towns and cities benefit from this because their OPEB costs essentially go away, and it should decompress the courts a bit, because the number of torts lawsuits that are being brought should actually diminish, as people know they don't have to worry about paying for their health care costs. They're already covered.
Other questions for Dr. Ryan? Well, thank you for your years of work around this issue. I hope there are not multiple years ahead of you on this work also.
I hope not too, but thank you for very much, Senator, for putting up with us all this time. So, again, we the lunatic fringe appreciate your attention.
Thank you. Next, we're going to try to connect with Gregory Waksmolsky. Mr. Waksmolsky, are you on with the committee?
Yes, I am. This is Gregory Waksmolsky. Can you all hear me all right?
Yes, we can. Go right ahead.
Thank you so much. First of all, I want to extend my gratitude to absolutely everybody who came out tonight from the community, private citizens taking time out of their own nights to come out and testify on what are some of the most exciting pieces of legislation in front of the Senate, House, and Human Services Committee so far this year. Absolutely, my hat goes off to you. I also want to say thank you, my deepest gratitudes to everybody who's serving on this committee. The chair, Vice Chair Valverde, Secretary Lawson, everybody who sits on this committee on the regs. You all are doing a very important service to everybody in this state, and the decisions that you make here with these pieces of legislation are going to instruct the nation. You know, we're all talking to you guys tonight about Medicare for all, single payer, health care as a human right. I don't want to take up too much of your time, so I just want to share with you a story of two broken bones. The first one happened about 2010. I was already a grown person. I was living in the United Kingdom. As you're all aware, the National Health Service provides universal coverage to everyone who lives within those borders. I suffered a pretty serious fracture to my jaw. As a male growing up in the United States, I was loath to reach out for any kind of help from the medical profession for a variety of reasons. But the most important reason that stood out in my mind was that throughout my life, medical care meant money. Seeking medical care cost me money in the United States of America. And that was a very hard thing to shake. Even having lived in a place where medical care was universal for almost 5 years at that point, it was extremely difficult for me to go to the hospital and have my malady addressed by professionals. I had to be talked into it, in fact. People had to look at me and say, "Greg, you're all banged up. You need to get to the hospital." I remember when the radiologist looked at my x-rays and shook his head, and he said, "Why did you wait to come in? Why did you wait?" And I sat with that. It was a long recuperation. The bone set, and I was just fine afterwards. And you know, when the two surgeons who worked on me were standing over me when I came out of my anesthesia looked at me, they said, "You know, it was rougher in there than we thought, but we did everything we could." I knew that a universal single-payer healthcare system took care of professionals. It took care of people who needed help in medical emergencies. I felt so cared for. I was blown away. I started to cry. And I remembered the radiologist's question to me, "Why did you wait so long?" The other story happened when I was much younger. I was about 5 years old, a broken arm. I got taken down to the hospital. It cost my parents an arm and a leg, excuse the pun. And then about 2 years later, it happened again on the other arm. And you know what happened that time? We were a working-class family. We used to chop wood to put into the furnace to keep warm in the winter. We didn't have money that time. We did not have money that time. So while my right arm had been addressed by medical professionals, my left arm was not. It just had to heal up. That was a horrible situation for me to be in at 7 years old, to have my father looking at me and saying, "You know, we just can't afford to take you down to the hospital." So my question to all of you, and keep in mind, this is only the first hearing for all these bills. There's a really great raft of ideas floating around on how we can all work together to make sure that this state leads the nation and covers absolutely everywhere in a universal system. My question to you is, why wait any longer? Haven't we waited long enough? Thank you again for your time. I really appreciate, again, everybody participating in our civic duty out here to create great policy that's going to save lives and make health care truly a human right for everybody. I'm open for questions if there's any time left.
Any questions for Mr. Walsmowski? Well, I think 3 or 4 bones is enough. Watch where you walk. And thank you for calling.
Words of wisdom. Thank you so much.
The next person we're going to try to get on the phone for her testimony is Jacqueline Goldman. Miss Goldman? Miss Goldman? We're going to try that connection one more time. Ms. Goldman, you on now?
Yes. Yes. Hello. I have not submitted written testimony, and I'm here to support 233, 49, 109, and 230.
Oh, good. You've been listening in, so I didn't have to do
Of course,
all that.
I've been listening in.
Oh, good.
My name is Jacqueline Goldman. I'm an epidemiologist, but more importantly, I am a person with a body who struggled in the past to get adequate healthcare coverage. I'm not going to give you the rationale and talk about the economics of this. People have done that, but I just want to share a quick story. From fall 2015 to spring 2016, I was an AmeriCorps volunteer for a program called the National Civilian Community Corps. This is a group of 18 to 22-year-olds who move every 2 to 3 months to do really essential service work, including forest fire reduction work, building hiking trails, building Habitat for Humanity, and things like that. In the very end, the thing with the program is you get paid $1.12 an hour. That's before taxes. And they say, that's fine. We'll feed you. We'll house you. We'll give you health care. Very first week of the job, I get poison oak. Being in California, poison oak is everywhere. I go to an urgent care to get this checked out. And that bill, in and of itself, was $400, and my insurance didn't cover it. Now, that doesn't sound like a lot of money, but keep in mind, for what I was being paid by the government, that was over a month of my stipend. People here are sharing stories that are far more catastrophic and far more serious about far more serious healthcare issues. That being said, if people who are spending full-time volunteering and getting compensated by the federal government cannot even afford basic healthcare bills, we have seen that this is a problem. Rhode Island loves its private health insurance industry. CVS and Aetna are down the street. Our Medicaid programs are privatized, which is fully a waste of money, and as everyone has said. Single payer will help us save money for everyone and will ensure that everyone has access to health care. This is legislation that we must pass now. You've heard people in tears. You've heard people who are crying for their lives, and failing to pass this legislation would be a real mistake. So I appreciate you giving the time and the patience for everyone here testifying, and I urge you to pass all 4 of these bills. Thank you so much.
Any questions for Ms. Goldman? Thank you for calling in. Okay, I think this might be a good time while we have a few people that have either disconnected or aren't answering. Maybe we can go through now with some of the motions on the legislation, so we don't either oversee it later or start losing people without a quorum. So is there a motion to hold for further study? Senator Bell, number 49.
I move we hold Senate Bill 49.
Is there a second?
Second.
Will the clerk take a roll on 49, please?
Senator Bell.
Nay.
Senator Calkin.
Nay.
Senator DeMario.
Aye.
Senator Golden.
Aye.
Senator Lawson.
Aye.
Senator Valverde.
Aye.
Senator Miller.
Aye. Next, a motion on Senator Calkin's number 109. Is there a
I would
motion?
like to move passage on that
The motion is to hold for further study.
for the resolution for federal
Yeah,
support.
there's a motion
I
right
second
now.
Senator Calkin's motion.
There's a motion right now to hold. I'm asking for a motion on that.
Mr. Chair, I thought a motion was made for passage.
A motion was made. I
And seconded.
asked if there was a motion to hold. Is there a motion to
Senator
hold?
Calkin made a motion for passage. We can now vote on that motion. It's made and seconded.
Is there a motion for passage? The clerk will take a roll on that.
Senator Bell.
Aye.
Sorry, which motion are we voting on?
This is
Motion
a motion
for passage.
Senator Bell. There's a motion for passage by Senator Calkin, seconded by Senator Bell. The motion was initially to hold, but I was interrupted. So we're going ahead with the motion to pass. So we'll continue that vote.
Senator Bell.
Aye.
Senator Calkin.
Aye.
Senator DeMario.
Aye.
Senator Golden.
Aye.
Senator Lawson.
Aye.
Senator Valverde.
Aye.
Senator Miller.
No.
Six to one.
Okay. So the chair recommends a motion to hold on 230.
So moved.
Second.
Clerk will go through the roll.
Senator Bell.
Nay.
Senator Calkin.
Nay.
Senator DeMario.
Aye.
Senator Golden.
Aye.
Senator Lawson.
Aye.
Senator Valverde.
Aye.
Senator Miller.
Aye. The next motion is a motion on 231, Senator Golden.
Motion for passage?
Second.
Second.
The clerk.
Senator Bell.
Aye.
Senator Calkin.
Aye.
Senator DeMario.
Aye.
Senator Golden.
Aye.
Senator Lawson.
Aye.
Senator Valverde.
Aye.
Senator Miller.
Nay. And I want to explain the reason why we're offering motions to hold or recommending motions to hold is there is very clearly, and I think even the sponsors would agree, that there are technical and policy issues with all of these bills, whether we like them or not. And to pass them without that work is a serious error in judgment and policy, and is not recommended, because these bills, including Senator Golden's bill, has issues of drafting, as the bills that were passed, which was not recommended, have issues of drafting that need to be addressed. And so that's why the recommended motion on these bills is to hold them. So just be aware of those issues as you consider the votes to hold or pass on these bills. It's an interesting procedure, but it's not effective.
Mr. Chair?
Yes.
I just also wanted to mention, many of these bills have been heard year after year, some of them 5 years, and have been passed previously. I think Senator Golden's bill was passed previously. And I also wanted to mention that, you had asked us to have faith in you regarding the telemedicine bill, even though it was an imperfect bill, that changes would come and we could fix it on the floor. So, if there are any technical changes or anything like that, I'd be more than happy to, to listen to those and make the changes.
Yeah, it's not a preferred procedure to have something amended on the floor, especially when there are several changes. We don't want, using the telemedicine bill as an example, we don't want it to be sent back to the committee, especially when you're meeting once a week. That's not a preferred procedure to have a bill bounce back and forth between the floor and the committee, and that's what motion to pass can do, as we've seen with the telemedicine bill. And it's not a preferred path for a bill to have it brought forward to the floor. Further work is identified, and then it goes back to committee. Meeting once a week, that methodology is definitely not preferred. And that's why all of these bills, as important as they are and as much support as they do have, it's not a preferred methodology for either the committee or the Senate as a whole, or any other committee. So with that, I recommend a motion to hold based on that conversation on Senator Bell's 233.
So moved. Second.
All those in favor, the clerk?
Senator Bell.
Nay.
Senator Calkin.
Nay.
Senator DeMario.
Aye.
Senator Golden.
Aye.
Senator Lawson.
Aye.
Senator Valverde.
Aye.
Senator Miller.
Aye. Let's try to get back to hearing testimony. The next call we'll try to connect with. Okay.
Ben, can I ask a question?
Sure.
If we've passed two of these bills, are you still taking the testimony on them?
Well, we'll hear testimony with, I think with the bills that are still remaining, most of the people that remain testifying will probably be also testifying on other bills, so we'll be careful to note what bills they're testifying as we're going forward.
Thank you.
Okay. Mr. Marsh? Mr. Marsh?
Hello.
Yes.
Hi, my name is Jesse Marsh. I'm calling in support of Bill 233. I have not submitted any written testimony, and I want to thank you all for taking the time to hear me out for a couple of minutes. So a little bit about myself. I'm 41 years old. I am married. I am the healthcare provider through my job for both myself and my wife. My wife is self-employed. She's a hairdresser. So she is currently in a place through her employment where she's unable to provide us with health insurance. So it is up to me. I was employed at Brown University. I was lucky enough to be working there for about 10 years. They had very, very good insurance while I was working there, but of course it's not feasible for Brown to employ every citizen of the state of Rhode Island. So during that time, while I was employed, I was diagnosed with Crohn's disease, which is an autoimmune disorder that affects the digestive system, but I felt really fortunate that I had good health insurance at the time. Later on, I ended up getting a new job in Massachusetts, which has subsequently led to billing issues caused by coding issues, and inability of Blue Cross Blue Shield of Rhode Island and Blue Cross Blue Shield of Massachusetts to kind of get along with one another. That's kind of caused problems for me. And then I started another job. Now I'm insured under United Healthcare. I went for the best that I could possibly get, knowing that I have, significant medical needs and coverage that needs to happen. Even with the best that I could do through my employer, I am paying high premiums, and I have individual maximum $3,000 of co-insurance that I need to pay annually, which I will max out every year for the foreseeable future or for the rest of my life. And I believe it's $8,000 should anything happen to my wife. That's the family insurance out-of-pocket maximum. So I'm telling you all of this just because I actually consider myself to be one of the lucky ones. Again, I had insurance that was very good for a very long time. I had the ability to kind of advocate for myself and get in touch with and navigate the kind of labyrinth of health insurance providers and advocate for myself and say things that should have been covered. But I really want to point out that, a lot of the citizens in the state of Rhode Island are not able to do that. And I think even for someone like me, I feel like I'm fortunate that I can kind of budget and save money and work enough to cover my own co-insurance bills. But honestly, I think that many people in the state are really just one sickness or injury away from ruin. And so passing Medicare for all in the state of Rhode Island would be a huge boon to every citizen that lives here. And I think that decoupling health insurance from jobs is crucial. And that's pretty much all I have to say. And I want to thank you all for taking the time to listen to all of us tonight.
Any questions? Thank you for calling in.
Thank you so much.
Next person we're going to try to connect with is Joel Reinstein. Mr. Reinstein?
Yeah, speaking.
Go right ahead and let us know what bills you're testifying on and whether you have any written testimony.
I'm testifying on S-233, the Comprehensive Health Insurance Program Act.
Go right ahead.
And can I ask, how is this? I'm not used to sort of remote testimony by phone. Is this like part of a public hearing, or what's the story here?
Yes, it's exactly as if it was a public hearing, so it's if you were testifying in front of the committee. And it's part of the Capital TV broadcast also.
Great, thanks so much. Yeah, I mean, I think this is really straightforward. I support Medicare for all in general. I think that it's not that complicated. There shouldn't be for-profit companies inserting themselves between human beings who need health care and the process of paying for it. There shouldn't be someone profiting off of human misery. It's Sam Bell's bill is a step towards actually having a system where everybody pools their money for the sake of human welfare and healthcare. So I support this bill. I think that it's a great step forward, and it's actually not even as much as what we need. So I don't think there's any justification for opposing it.
Any questions for Mr. Reinstein? If not, we'll try another witness. Okay. Okay.
journalists, different.
Ms. Ferraro?
Hi, yes.
Go right ahead. You're on with the Senate Health and Human Services Committee. Let us know what bill you're testifying on and whether you had submitted anything in writing.
Hi, I did not submit written testimony, and I'm testifying in support of Senate Bills 49, 109, 230, and 233.
Go right ahead.
All right, my name is Julius Ferraro. I'm here to testify in support of those four Senate bills. I'm calling as a citizen of Providence and also as a member of the Providence chapter of the Democratic Socialists of America, a grassroots organization with 450 members locally, which has endorsed Senate Bill 233. I want to point out, I'll be super brief. I just want to point out the numbers we've been discussing, which is 450,000 people in Rhode Island underinsured. That's 45% of Rhode Islanders rationing their own health care because they fear health care costs. Those numbers are from 2019, before the pandemic. So those numbers are from before the mass unemployment, mass sickness, and mass death caused by COVID-19. Who knows what those numbers are now? So let's just get real and think about a future where society works for everyone, not just for the wealthy, lucky few, but for the masses, especially because this was just held for further study. Let's think about a society where that works for the poor, for the working class, and for the middle class. Rhode Island and the members of this committee can be leaders in creating that society by showing the richest country in the history of the world that it can afford to actually take care of its citizens. I guess it's too late to say this, but I'm calling to strongly encourage the members of this committee to vote in favor of Senate Bills 49, 109, 230, and 233, and in doing so, to vote in favor of the people of Rhode Island. Thank you.
Any questions for Mr. Ferraro? Thank you for calling in.
Thanks.
Next, we're going to try to get Justin Riojas to speak to the committee. Mr. Riojas?
Hi, yes.
Go right ahead.
Oh, good evening. Thank you. Thank you to the members on this committee for holding this important hearing. And a huge thank you to Senator Mendes for sponsoring this resolution. I'll be very brief. My name is Justin Royes. I'm a licensed therapist, a school social worker by trade, and a proud resident of Providence. And I'm here to express my full support for Senate Resolution S0230, which would implement a commission to study the prospect of having a Medicare for all single-payer system in our state. And of course, I support this resolution because I believe a commission would move us closer to achieving that goal. And I believe that's the right direction for our state. As a licensed therapist, I've experienced firsthand of how private insurance has failed my clients who suffer from serious mental health disorders and psychological distress. Any mental health professional out there will tell you that insurance companies intentionally create obstacles to much-needed mental health care. They force patient and clients to delay treatment for fear of cost. And our current system allows these insurance companies who are not trained to care for clients and patients to determine the cost of treatment. And so a single-payer healthcare system would increase access to mental health care and take away the lengthy paperwork and complicated appeal processes that patients and clients must jump through to get even a fraction of their treatment covered. And so I urge this committee to do the right thing by voting this resolution out of the committee. Thank you.
Any questions for Justin? Senator DeMario.
Thank you, Mr. Chair. I just wanted to thank you for your testimony. As a fellow mental health care provider, I'm really happy that somebody called in with that perspective tonight, so thank you very much.
Oh, thank you. I appreciate that.
Thank you. Next, we're going to try to connect with Kate Shapira to testify. Kate?
Hello?
Go right ahead. You're on with the committee to testify. Let us know what bill you're testifying on and whether you have written testimony.
Hi, my name is Kate Shapira. I'm testifying on. Hello?
Yes, go right ahead.
Great. Hi, my name is Kate Shapira. Yep. Hi, can you hear me? Okay.
Yes, we can.
Great.
Yep.
All right. I'm asking you to move Senate Bill 233 to the floor for a full vote as soon as possible, because it seems clear that it will make everyone in Rhode Island healthier, safer, and able to live better lives, and not just the people whose health care the program covers. And by the way, this is not written testimony that I've submitted. This is brand new. We think of illness as spreading, but health also spreads. And I'm going to give you some examples. Some of them are real, and some of them they're from me and people that I know, and some of them are what I would expect to see if this were passed. So my friend Jenna was hit by a car while she was riding her bike, and because she had health insurance through her job, she was able to go to physical therapy. This enabled her to ride her bike again, which improved her physical and mental health overall. This in turn made her more patient with her kids. It also led to one less car's worth of traffic, which benefits everybody on the road, and one less car's worth of pollution, which benefits everyone, period. If someone's trying to leave an abusive relationship, but her spouse is the one with the health insurance, either going or staying could end in suffering or even death for her or her kids. If anyone in Rhode Island can have health coverage, she can leave, and she'll have more money to start a new life. The Rhode Island Comprehensive Health Insurance Program could cover counseling for her and for the kids, which would set them up to do better in their academic and their social lives with better possibilities for their future. Another friend of mine, Zoe, is still young enough to have health care through their parents. This allows them to treat their mental illness consistently, which means instead of lying in bed feeling like death, they're able to leave their house, work a job, make art, and organize for their community. Healthcare for them is the difference between being an active, thoughtful, compassionate member of the community and being too exhausted and too isolated to leave the house. An engineer and an inventor I know has been trying for years to open his own design lab, and the biggest stumbling block is the cost of employee-sponsored health care. Without the cost of insuring workers themselves, the small businesses that Rhode Island claims to value can take off. I know that I don't have to explain to you why it's valuable to our state for smaller businesses to remain active, retain good employees, and pay them fairly, and why it would matter to the economy as well as to people if workers could afford preventative care, be in better health, and need fewer sick days. A CAT scan that was paid for by my work insurance revealed that the source of my husband's chest pain was a blood clot and probably saved his life. Doctors are already having trouble getting insurance companies to approve and pay for tests like CAT scans for patients who have long COVID or post-COVID complications. We're going to be seeing more and more of these conditions among our families and neighbors in the coming months and years. If they can get tested for lung damage and blood clots and other common after effects of COVID and get preventative care, they may be able to preserve their abilities to speak, move easily, and think clearly. Of course, this will make their working and their family lives easier. And if they lose those abilities, the work that they lose or the care that they need will not bankrupt them. It also will not bankrupt and otherwise drain their families, cutting them off from their own professional growth, education, and parenting, or even from paying their rent. The Rhode Island Comprehensive Health Insurance Program could help people in this and similar situations stay in their own homes and pay for their own groceries, freeing up state resources like public housing and food banks for others. They will be able to support their neighbors through hard times and times that may not be as hard as they would have been because a financial burden and a burden of fear have been removed for all. They will be able to learn more, build more skills, do more kinds of work, and advocate for better conditions in which to do that work. They will be able to participate more in the civic life of their city or town and of our state. They might even have the time and energy and presence of mind to testify at a public hearing or two. This testimony from me is brought to you by my health care coverage, the therapy it pays for, and the life-saving surgery for which, without insurance, I would still be in debt. I want everyone in Rhode Island to be able to get the care that they need. Please do your part by bringing Senate Bill 233 to the floor as soon as possible. Thank you for your time.
Any questions for Kate? Thank you for your testimony. And thank you for your health insurance allowing you to testify. The next person we're going to try to connect with is Dr. Kathleen Hankins. Dr. Hankins? Dr. Hankins? Dr. Hankins,
This is she.
go right ahead with your testimony for the committee and let us know what bill you're testifying on.
Thank you. This is testimony supporting Senate Bill S0233, Comprehensive Health Insurance Program. My name is Dr. Kathleen Chase Hankins, and I'm here to testify as a resident physician practicing.
Dr. Hankins, sorry about the disconnect. Go right ahead.
No problem. Thank you. So my name is Dr. Kathleen Chase Hankins. I'm here to testify as a resident physician practicing urologic surgery at Brown University and as a citizen of Providence, Rhode Island, in support of Senate Bill S0233. I became a doctor to treat and take care of all patients, not just patients with insurance, not just patients with the financial means to pay, but all patients. As part of our training, we run a clinic for uninsured and underinsured patients who otherwise would have no access to urologic care in Rhode Island, including care for prostate cancer, kidney cancer, and bladder cancer, of which Rhode Island has the highest rates in the country. Every week, I see Rhode Island residents who are desperate. They cannot afford the basic medications that I prescribe to manage their chronic conditions. They cannot afford the imaging I order to surveil their cancer. They cannot afford the diagnostic tests recommended by our national guidelines to accurately diagnose their conditions. I have consoled many of these patients while knowing that the way our healthcare system is structured, I have nothing more that I can offer them. This injustice hurts, particularly when we know how to solve it. The rest of the developed world have provided an excellent demonstration of the benefits of universal single-payer health care. They spend far less money to provide better care with improved health outcomes to their citizens. They do not waste nearly 1/3 of their healthcare dollars to administrative costs. Their physicians do not need to take time away from patient care to argue with insurance companies who are trying to avoid paying for essential medically necessary treatments. There are many reasons to proceed with Medicare for all, but please do not forget there are people at the other end of this decision, people who are in need of affordable and accessible health care now more than ever, and we have a moral obligation to help them. I strongly urge you to support S0233 Comprehensive Health Insurance Program. Thank you.
Any questions for Dr. Chase Hankins from the committee? Thank you for taking the time on your testimony. The
Thank you
next
very
person
much.
we're going to try to connect with is Kelsey Rilo. Okay. Okay, we're skipping ahead to Kevin Kapelski. I know I messed up your last name, but Kevin, go right ahead. You're on with the committee.
Hi. My name is Kevin Chapieski. I'm calling in support of Bills 233, 109, and 49, and Medicare for All generally. I have not submitted written testimony. I don't have much to say here aside from, thankfully, a few anecdotes. For several years, I felt resigned that I likely had testicular cancer and that getting it checked out or treated would bankrupt me, so it was probably just safer to stay away from the doctor and just hope that, it wouldn't develop or was benign. Once I finally got up the nerve to actually go to the doctor and get it checked out, thanks to Affordable Care Act, I was relieved to find that it wasn't cancer. Lucky me. About a year later, a routine physical revealed that I had hereditary high blood pressure, and the doctor was shocked that I hadn't had a heart attack at age 34. Again, my state insurance covers my medication, which just today I found out from blood work that medication successfully brings my cholesterol down to healthy numbers. In both cases, I've been supremely lucky, but I can't help but think what would happen otherwise if things had gone worse, if I didn't have the insurance or the money to cover it. I'm terrified of the day my luck runs out. There are so many people in this state, some I'm sure you've heard from tonight, that don't have to imagine. It's their reality. It can't keep on like this. We need single-payer, universal health care. Please move these bills forward. Thank you.
Any questions for Kevin from the committee? Thank you for testifying, Kevin.
Thank you. Have a good night.
Yep. Senator Paolino was in the Finance Committee. He's switched over to us. We welcome Senator Paolino to our committee today.
Thank you, Chairman.
Yep. The next person we're trying to connect to testify is Kimberly Paulino. Kimberly? Kimberly?
Yes.
You're on with the committee if you have testimony, and tell us which bill.
You said which bill?
Yeah, which bill do you wish to testify on?
I can't remember exactly the number of the bill, but
Okay.
it's basically the Senate Medicare for All bill.
Sure, go right ahead.
Thank you. So yeah, my name's Kimberly DeCoupe, and I'm one of the co-chairs from the Providence DSA. And when I was about 19 years old, I developed a chronic stomach condition called IBS, irritable bowel syndrome. And during this time, I quickly lost a ton of weight. We're talking about 30 pounds in 2 months, and was hovering slightly over 100 pounds. And it was difficult for me to be out for an extended amount of time with friends or family because I was suffering from dizziness and fainting spells daily. And so I was scared that I'd faint in public and put myself in a dangerous situation. I couldn't sleep, and I couldn't eat anything that wouldn't cause a bellyache, essentially. And so, just for context, I was somebody who loved food. I very much enjoyed eating. I come from a Dominican household, and we love to cook. But by this time, eating became more of a chore, something I had to do, not something that I necessarily wanted to do. And I have to say that there is truly something different about the kind of intimate pain and suffering that one feels when one understands their body is given up on them. I think all of your dreams and hopes, goals, they quickly recede into the background as you wrestle with mortality and the ongoing stress of just fighting to live just chips away at who you are and your sanity. And your body almost becomes an instrument of torture for your soul. And the soul just grows ever more desperate as it becomes clear that it's residing in a body that is decaying. And so knowing that, that I just laid out right now. How do we justify a system that takes someone like me and attempts to make money off of them? How do we justify a healthcare system that extracts money out of people when they are on their deathbed? How do we justify a system that seeks to profit off diseases and the physical and mental agony that they bring upon people? I just don't understand how we dare do such a thing. This is the United States of America, a country that fought a civil war because some folks felt that it was their right to make money from the enslavement of people, black people to be exact. And so we decided then that not all ways of making money are virtuous and right. That if one needs to kill, rape, oppress, torture, disenfranchise, or deceive to turn a profit, that method of making money has no right to operate within this country. We today have a healthcare system controlled by for-profit insurance companies who are making a killing by denying life-saving care to people when they need it most. A crime so egregious it sentences 40,000 Americans to die every single year. Those are our neighbors, our friends, our community, our family who are often being sent to an early grave for what crime? For not having enough money to pay for health care? Are we serious right now? It is barbaric and even more infuriating when you find out that many of these crazy expensive drugs and treatments are funded to the maximum by the taxpayer. We as a people are essentially already collectively paying for health care, but are being denied the treatments and the drugs that our public money created so that a few wealthy people can make out like bandits. Insurance companies know people will do anything to live, and so they resort to extorting people for all they can pay because the ability to live, read, fall in love, make friends, grow, learn, explore is everything to people. And that's why Medicare for All needed to be passed yesterday. It is shameful how many people we've allowed to die within the state throughout this pandemic, many of them being our elders, in huge part because we didn't have a single-payer healthcare system that would guarantee healthcare to everyone in the state. Now, let's be clear. If Medicare for All had been implemented before the pandemic, our contact tracing would have been more effective as it's easier to keep track of folks if they're all in the same system, thus decreasing the spread of COVID and thus lowering the mortality rates, and the vaccine rollout would have been smoother for many of the same reasons. Right now, we're vaccinating so slow, it's going to take years to end COVID at this point. It's unacceptable. I ask those who are listening today, are you not tired? Are you not tired of paying an exorbitant amount of money for health care coverage that hardly exists? Essential workers, you have done so much for your state throughout these incredibly bleak and unstable times. Are you not tired of being asked to risk your life in a pandemic? Meanwhile, you do not have health care. Medicare for All would guarantee health care to every man, woman, and child in this state in a cost-effective manner that would, in essence, function like a tax break for most people by getting rid of the greedy, for-profit insurance companies. Medicare for All would guarantee that a billionaire and the homeless guy on the corner of Broad Street get the exact same quality of health care. Ain't that the type of system that enshrines one of the founding ideas of this country? Every American is born equal. Folks, the solution to this healthcare problem does exist. It's called Medicare for All. Now, I've been afraid all of my life, and I have anxiety-induced disorder to show for it. And I'm here to tell you, and those listening from home in the committee, that I'm tired of being afraid. Aren't you tired of being afraid? I don't know about you, but I'm ready to solve this issue once and for all. It's time to make sure that Medicare for All is a reality in this state, and I expect this committee, who is coming from a state that was the COVID capital of the world and whose nursing homes became damn near morgues through sheer neglect, to forward this bill to a floor vote immediately. I'm done.
Any questions from the committee?
No. The only thing is they need to forward this immediately to a floor vote.
I'm asking the committee if they have any questions for you.
Chair, am I allowed to?
Sure, go
I know
right
I'm not
ahead.
part of the committee, but I know Kimberly was speaking to one of my bills.
Sure, go right ahead.
Kimberly, I just wanted to thank you for your powerful testimony and the vulnerability that it takes to share your pain and our collective pain under our current system, and beg for this committee to move bills that essentially have already been decided to be tabled, probably well before we even got on this call. And so I think that it's really important that we kind of also understand that I actually feel like I owe you an apology, because it is hard to pour your heart out and your soul out and your pain out, knowing full well that we are, 5 or 6 years with this study bill, and it's not going to happen this year. And so I feel like that's insulting to those and to every single person that has shared and didn't have to share. Didn't have to share your struggle. You didn't have to share your pain. And by the way, that's the heart of injustice. And you are, I know, I don't know you, but I've seen you, and I know that you fight for justice constantly. And so the heart of injustice is that when there's a system that is broken and hurting people, those very people have to then expose themselves and put themselves in a vulnerable situation to fight for justice, while those that benefit from a broken system get to sit back and prevent progress and prevent healing and prevent the suffering of others. And so, that's how injustice is compounded. And so I'm conflicted as someone who is putting forth a bill that I know is right and good, also knowing that it will not probably get the support that it needs and deserves, even while 100 people beg for it. And so until we continue to organize and recognize injustice for what it is, we will continue to see that. And I promise that you will have every ounce of my energy to support you, and that we will no longer have a system that forces people to be vulnerable and explain their hurts and their suffering to beg to be recognized for the bare necessities. So you have my word on that.
Thank you.
Senator Bell?
Thank you so much, Chairman. Ms. DeCoop, I really want to thank you for your really compelling testimony. I think it's so important that we remember the human beings on the end of our healthcare payment system, and that it can't just be a dry and impassionate discussion about payment models. These are human lives. These are the shape of people's lives. And that's what this is really all about. So I think your testimony really, really highlighted that, and I really want to thank you for sharing your story.
Thanks, Senator Sam Bell.
Senator Calkin?
Thank you, Mr. Chair. I also wanted to thank you, Kimberly, for all the work that you've been doing over the years as well, and for your passionate testimony. It's indicative of what I've heard from lots of other folks. And I think, Senator Bell said it very well in that, this is really a personal issue. A lot of times we look at things in terms of dollars and cents, but we're talking about people's lives. How many people, have stopped, going to the doctor or stopped their care because they're afraid of going bankrupt. My mom is one of them. So I appreciate your testimony.
Any other questions? Before we get on to the next caller, I would just like to respond to something Senator Mendes said. She talked about the bills being tabled. The bills were not tabled. The bills that didn't pass, they were held. And often and historically in this committee, bills are held not necessarily to have them disappear, but to work on them in a way that will make them available for a vote on, not only in this chamber, but the other chamber, and a signature for the governor. And without the work that goes on once a bill is held, that the work that is done on behalf of the legislation can't proceed. So
I would just like to say one last thing and just say that, thank you so much, progressive politicians. You guys are the future, for sure. And we're going to make sure that we put more of you in there so we get this done. I'm done.
Thank you.
Bye.
Bye. So I just wanted to clarify that before we went on to the next caller. The next caller will be Kirk Robinson. Kirk?
Yeah, that's me.
Go right ahead. You're on with the committee, and just let us know what bill you're interested in testifying on.
Yeah, no problem. Thank you very much. My name is Kirk Robinson. I live in Providence at 11 Eagle Street. I am testifying in support of the Senate Bill 233, 49, 109, 230, 379. I have not submitted any written testimony. Right, so I've been watching this broadcast for a while now. And, it's really my sincere hope that the bills which have been moved for further study are moved back onto the calendar, especially in light of the unanimous support that I've heard so far. I've been watching this for pretty much as long as it's been on. And I would think that what I just said should have some especially should have some relevance considering the testimony that we just heard from the previous caller. So, anyway, right now you're talking to a lucky man, okay? I've got a good job, I've got health insurance. But I'm one bad unlucky streak away from losing what is a tenuous sense of safety. So I've been listening, like I said, I've been listening to this testimony from our fellow citizens. And in their personal life stories, you know what I hear? I hear fear in their voices. I hear tragedies exacerbated by a lack of consistent, unquestionable health care. And in listening to all of this testimony, a question that keeps popping into my head is, what is it do we owe to each other as people living in a society? Let me repeat that. What do we owe each other as human beings living in a society together? The answer is a lot. I think the answer is everything. I understand that that's a tall order. So for now, I would hope it would be something as minimal as providing some semblance of safety that universal health care would provide. In our current healthcare system, we are making a choice to subject people to fear. We are choosing to allow people to experience the darkest depths of human suffering. And we're choosing to restrict people's freedom. Freedom from a bad job, from leaving a bad job. Freedom from leaving an abusive spouse so they can continue to have health care. It's in service of what? Profits for private health insurance companies, so shareholders can extract value from what should be a public good, which is something that everybody in a society should have for free. So, I urge the honorable members of this committee to make a different choice today. Let's choose to provide universal health care to our fellow Rhode Islanders and support the aforementioned bills. Thank you.
Any questions for Kirk from the committee? Thank you. Next person we'll try to connect with, Kristen Caffrey. Kristen? Kristen, are you on? We'll try once again. Kristen?
Hello?
Thank you for calling in. You're connected now. Let us know what bill you plan to testify on.
Hi, my name is Kristen Caffrey, and I'm testifying in support of Senate Bill 233 as a resident of Providence, Rhode Island, and as someone who lives with a serious and chronic neurological condition. Luckily, I was insured in 2017 when I first fell ill, but my insurance is through my employer. I had to battle showing up to work every day with my brain slowly shutting down just so that I could have access to medical care.
I fear losing my job more than anything because without access to health care, I would be in serious trouble. Without access to health care and treatment, my illness can look like multiple seizures a day, which then makes it almost impossible to work or show up for life. Through the pandemic, my hours have been cut at my job, and because of this, I am dangerously close to losing my benefits. No one should have to worry about losing their benefits during a pandemic or worry about the cost of gap insurance, which almost no one can afford. Health insurance should not be tied to employment. So many Rhode Islanders that are actually insured get their health insurance through their employment. And as we've seen with COVID, employment has been severely affected. I support this bill because I believe it should be the right of every Rhode Islander to have quality health insurance that is not tied to the job that they work. We need Medicare for all here in Rhode Island. Thank you.
Any questions? Thank you. We'll move on to the next caller, who should be Leah Schumacher. Leah, you're on with the committee.
Thank you. My name is Leah Schumacher. I'm here to testify in support of Bill 233. I'm a clinical psychologist who specializes in behavioral medicine, so I work with a lot of people with chronic illness. I'm a citizen of Providence, and I'm a person who has healthcare needs. I support this bill because I believe all people should have access to high-quality healthcare, and no one should live in poor health without appropriate care. I wanted to share a quick story about my own experiences with healthcare. I'm in my early 30s and I'm in generally good health. In my mid-20s, however, I began to have knee pain. I put off going to the physical therapist for months and was hesitant to get testing when this was recommended because even though I had health insurance, copays were really high and I wasn't earning a lot of money at the time. After I finally got testing, I learned I had hip dysplasia that had gone undiagnosed since childhood, and that I had osteoarthritis in my left hip and needed a hip replacement. I put off this procedure for several years, during which time I had daily pain in my hip and knee. I stayed as active as I could, but I had to modify daily activities like getting into a car and putting on shoes because I had pain in my hip when I moved in certain ways, and my joint mobility was poor. I was fortunate enough to get my hip replaced when I was 31. Had I not had health insurance, there's no way I could have done this. Even with my employer-sponsored health insurance, the surgery cost several $1,000s. I was in the hospital for less than a day when I got the surgery. Despite this, the bill was over $50,000. No way I could have paid that without health insurance. I was one of the lucky ones who could make it work and get care. I really encourage you to think about the 450,000 Rhode Islanders who are underinsured and can't seek healthcare services because of high deductibles and copays. Many people are experiencing pain or reduced quality of life because they're unable to get their care, the care that they need. I was going to say that I really encourage you to support this bill and move it forward, but it seems like that's too late for tonight. I heard comments made about the methodology of the bills not being perfect, and that's why the bills will be held for further discussion. People dying and suffering because they don't have affordable health care is also not perfect. So please do not let perfect be the enemy of good. Thank you for your time.
Any questions for Leah? Thank you for calling in. The next caller we'll connect with is Lee Wilder. Lee, you're on with the committee. Go right ahead.
Can you hear me okay?
Yes.
All right, awesome. I'm testifying on bill number 109 and 233 and all the Medicare for all bills in general, and I have no written testimony. My name is Lee Wilder. I've lived in Rhode Island my entire life, and I'm speaking as a disabled American. When my mom was 1 year older than me at the age of 23, she started working for the state of Rhode Island. She worked as a CNA in a nursing home for mentally ill people. She had no health care from the age of 18 to 23, so she had to pay $100 to be seen and $400 for 1 month's supply of one medication. To say that no one has ever died because they had no access to health care is a misrepresentation of the truth. Please don't deny us health care in a pandemic and put profit over our lives. Everyone against universal health care already has health care. So maybe this isn't your problem, but if we don't act now, this will be your children's and your grandchildren's problem. So who do you care about?
Is that your testimony?
Yep.
Okay. Any questions from the committee? Thank you for calling in.
Yeah, also, Greg Volsmowski, if you're still here, you should consider going into radio. You have a great speaking voice.
Yeah.
Have a good one, guys. Thank you so much.
Thank you. I think we have Leah Ledbetter on with us to testify.
Hi, Lehua Ledbetter.
Yep.
Hi, my name is Lehua Ledbetter. I am a professor at the University of Rhode Island, and I've been living in Rhode Island for about 6 years now. And I want to testify in support of Senate Bill SO233 for comprehensive health insurance, for the comprehensive health insurance program in Rhode Island. I'm testifying because 2 years ago, my mother got very sick. She was suffering from mental health problems, and she became so sick that she had to go to the hospital, to the emergency room, where she was diagnosed with psychosis and depression. She did not have health insurance because she was just over the threshold for the free health insurance option for the state, and the Obamacare insurance program was too expensive. She couldn't afford it. So she was in and out of the hospital a couple of times and ended up with a $20,000 hospital emergency room bill. And she wasn't able to actually get follow-up care or the long-term consistent mental health care that she needed. And she went about a year too sick to eat or drink, and most of the care that was given to her was provided by family. So she has recovered, fortunately. She's better now, but with the pandemic happening, I'm pretty terrified of what might happen again to family members and people who don't have health insurance. I think everyone deserves health care. So I hope you will act in support in favor of SO233. Thanks for listening.
Any questions for Ms. Ledbetter? Thank you for calling in.
Thank you.
Next, I think we have for testimony Linda Eibel.
Yes, hello?
Linda, go right ahead. You're on with the committee.
Okay, great. My name is Linda Eibel. I'm testifying in support of Senate Bill 233. I'm testifying as a Providence, Rhode Island resident and a family practice nurse practitioner. I work in a federally funded community health center that provides care for underserved communities, including many people who are un- or underinsured. I have not submitted any written testimony. I want to share a little bit of history. When the ACA was passed in 2010, I knew that it was far short of what was actually needed, but I felt that it was an improvement that filled in some major gaps in the healthcare system. My initial optimism was short-lived, as loopholes to the law were quickly discovered and exploited. Although the program allowed many people to get affordable coverage through Medicaid expansion and subsidies, many still could not afford any of the plans that were offered. Some who did purchase insurance through the exchanges found out too late that their plan was almost worse than nothing at all, with deductibles as high as $10,000 per year. Many folks simply kept hoping that they wouldn't need health care. Often those were people who worked full-time, often with multiple jobs. We know that people who are uninsured avoid preventive care and more often than not wind up in the ER with more serious and often preventable conditions and often receiving the most expensive care. A few years ago in the health center, I saw a middle-aged man who worked in the restaurant industry. He had never had regular health care because he was uninsured. He had signed up for Obamacare because he was told it was worth it to avoid the penalties, and he was happy that he found a plan that was affordable for him. So he came into the health center on a Saturday. He was obviously very sick, and he stopped in on his way to work. Since he now had insurance, he was able to get some blood work, an EKG, and an X-ray right after his visit. And then he went on to work, which is where I called him later to tell him that he needed to go to the hospital. It turned out not only did he have pneumonia, but he was also diabetic, which he was not aware of, with a very dangerously high sugar level. Within a year, he was diagnosed with a late-stage cancer, and now, after surgery, radiation, and many rounds of chemo, he is on hospice. I can't help but think that his outcome would have been different and his life longer if he had had regular access to health care. Primary health care providers spend countless hours on the phone trying to get needed medicines or tests covered. We know full well that the default for many insurers is to deny coverage and then make it so cumbersome, convoluted, and frustrating to appeal their decision that we give up. The system hasn't just failed consumers of health care, it has failed providers of health care. Medical practices and hospitals in Rhode Island are closing or merging, further limiting health care access. Burnout was high long before COVID, not because of the responsibilities of direct patient care, but because we are buried under reams of paperwork and the toll of the time and energy spent arguing with insurance representatives whose job it is to simply say no. Every time I write a prescription, I'm aware of what the out-of-pocket cost might be, often spending time checking the Walmart $4 list online and the GoodRx discount website during the visit. Pharmaceutical companies have patient assistance programs and savings cards, but the fine print tells you that people who are uninsured or covered by Medicare are excluded. Some patients now come in requesting hard copies of prescriptions so that they can order their medicines from Canada. Because of the richest country on the planet, their medicine is unaffordable. Our life-saving and prolonging medications, such as insulin and others for diabetes and inhalers for asthma and COPD, routinely cost upwards of $200 per month. In a country where a couple of years ago, a government survey found 40% of Americans would struggle to come up with $400 in an emergency, expecting people to pay several $100s per month every month for medicines for chronic conditions is absurd and unreasonable. And people simply do not get these medicines because they would be often choosing between medicine or food or heat or rent. A couple of years ago, I spent several hours over 2 weeks arguing with an insurance company to get a patient's prosthetic limb covered. I was shocked that in the United States, you could lose your leg in a workplace accident and then have to fight your insurance company in a Medicaid managed care plan to get your worn-out artificial leg replaced a few years later so that you could simply walk. During COVID, when over 7 million people lost their jobs, and for many, their health insurance as well, United Healthcare reported the doubling of their profit for the second quarter of 2020 to over $6 billion. Why? Because no one's premiums went down. But unless you had COVID and were sick enough to be in the hospital, no one was getting much health care at the beginning of the pandemic, as primary care specialist visits, non-emergent surgeries, and tests were canceled or postponed. That was not money well spent and would not have been spent under a Medicare for All single-payer system. As a nation and a state, we spend a fortune on health care and get poorer outcomes and worse access to care than other industrialized countries. As you've heard, globally we rank 37th, but number one in money spent. Our system is dramatically inefficient, with up to 30% of health care dollars going toward administrative costs, while for Medicare that number is down to 2%. So we know greater efficiency is possible when the motive for profit is removed. People don't want charity. They want to be treated like human beings. They want the care and tools to get and keep themselves and their families healthy, just like millions of people in other countries that do not worry about medical expenses. Medicare for All in Rhode Island is affordable. We are currently overpaying for health care with poor outcomes, where the only winners are insurance companies. In Rhode Island, as elsewhere, we pay middlemen millions of dollars to manage Medicaid plans with little accountability or evidence that money is well spent. A couple weeks ago, at the start of the mass COVID vaccination effort, the Department of Health acknowledged that maybe paying middlemen was more inefficient than the state providing vaccines directly, since it doubled the time it took to get vaccines into people's arms. We need to realize that our current healthcare system as a whole is made up of middlemen who are also making it inefficient and needlessly expensive. A single-payer plan would eliminate restrictive networks and formularies and allow the state as a whole to negotiate for lower costs. In 1942, in a bold move, Rhode Island became the first state in the country to develop a temporary disability insurance program, TDI, that provides a safety net for workers. Just as one province piloted the single-payer system, which spread to the rest of Canada and is considered one of the best in the world, Rhode Island could again be a pioneer if the state legislature had courage, conviction, and vision by providing another larger safety net for its residents and acknowledge that health care is a basic human right. That's my testimony.
Any questions from the committee members? Thank you for calling in. The personal stories are very valuable to the committee.
Thank you.
Next, we have Councilwoman Linda Ujafiza.
Hello. Can you hear me?
Yes, go right ahead.
Okay.
If you have written testimony, please paraphrase and identify the bills you're testifying on. Thank you.
Thank you. Hello, my name is Linda Ujifuza. I am co-chair of the Rhode Island Healthcare Access and Affordability Partnership, an affiliate of Physicians for a National Health Program. I want to thank you, senators, for hearing my testimony. I did submit written testimony, and I will certainly be very brief because I am absolutely humbled by the amazing testimony we've heard so far, and I believe a lot of the points I was going to make were made. Thank you, everyone. And I want to thank the senators who have sponsored the single-payer legislation and the MCO audit legislation as well, including Senator Miller and Senator Golden, who were the original single-payer Senate sponsors several years ago. So I'll start with S49 and just say, frankly, it's a no-brainer. The state has contracted with 3 private insurance companies that take care of Medicaid for 280,000 eligible Rhode Islanders, and they're paid about $1.7 billion a year to do that. And you would be fired in the private sector if you ignored them, as the state has been ignoring these elephants in the room. And you can see the shocking details in the op-ed in Uprise RI that I submitted. But here's the deal. For 12 years, the Rhode Island Auditor General has warned that these MCOs are essentially a black box with red flags, including a $200 million overpayment in 2015. So I just want to say that we could take a page from the Connecticut playbook, and private insurance company middlemen should not be thriving when our healthcare providers are financially strapped. And it's imperative that we do this audit now, because the 5-year contract with the 3 MCOs expires in 2022. So this is not a bill that can be held. We absolutely must do the audit, and I can see no reason not to do the audit. It is not implementing any kind of strange policies. It is simply asking that important research be done that could save the state hundreds of millions of dollars, as well as expand and improve Medicaid care. As for the single-payer bills, 109, 230, and 233, I submitted written testimony. I encourage people to go to www.pnhp.org for more undisputed evidence in favor of single-payer. You also have Professor Gerald Friedman from UMass Amherst's testimony in support of the Rhode Island state single-payer bills. I'll just answer that perennial question: how do we pay for single-payer? And we'll note again that we Americans pay twice per capita what they pay in Canada and other industrialized countries, and they have universal health care with better health outcomes. So the real reason, the real answer is that we are already paying enough for universal coverage under single payer. We are just not getting it. And I'll note that 2/3 of our healthcare spending already comes from taxes because we pay for Medicare, Medicaid, VA, government worker benefits, and tax subsidies. And private insurers are basically kept afloat by Medicaid and Medicare dollars because about 40% of their income, well, the income of the 5 largest private insurers, comes from these programs. So I'll end on a note, which is this. You are much more likely to get COVID-19 than get attacked by a foreign terrorist. And before and after COVID, you're much more likely to get cancer or diabetes or have a heart attack than get attacked by a foreign terrorist. So why not view national health insurance like military defense? It's a public good that should be supported by progressive taxes. We don't tell people that they don't deserve military defense because it's a benefit that they should purchase on the private market. Last thing, during World War II, William Knudsen, president of General Motors, agreed to FDR's request and gave up one of the most well-compensated jobs in America to take a government salary of $1 to head up all military production in the U.S. Gentlemen, he purportedly said, we must outbuild Hitler. Today, there should be this kind of public-private partnership between the government and healthcare providers, the builders of health, not middlemen payers. Thank you very much, and I appreciate your listening to me, and I'll take any questions you have.
Any questions for Linda from the committee? Senator Calkin.
Thank you, Mr. Chair. I just want to thank you, Linda, for all the work and time. I know how much time and effort you put in on this on a daily basis. And thank you for going into details on the MCO audit and why that is needed now. I appreciate that. And I think, what did you say the amount was? 200 and something million that we overpaid?
Yes. $200 million we overpaid in 2015. And for full disclosure, we did finally get it back, but it took 2 years of fighting with the health insurance companies to scrape that money back. And that was at exactly the same time we were reinventing Medicaid and deciding to privatize more. So while Connecticut was taking evidence and starting to de-privatize, Rhode Island took that same evidence and decided to privatize, which I think is a policy we must reverse.
Thank you. I imagine I can think of lots of really good things 200 and something million dollars could pay for, so thank you.
Yes, it's a chunk of change. Thank you.
Senator Bell.
Thank you so much, Chairman. I want to echo Senator Calkin's comments and thank you, Councilwoman Uji-Fuza, for all the work you put in on this legislative package. You've put in endless hours and have put a lot of thought into how to develop these bills. So thank you so much for all of your work. And I think it's really important what you bring up about the contracts being up for renewal for the MCOs. MCOs, just so everyone knows, is the euphemism we used for the private health insurance companies who manage Medicaid. It's stands for managed care organization. So I think that's a really important point, and something we really need to think about when those contracts come up. And related to that, there's still a conversation about whether the duals program will be reprivatized. I think it's really important that we think about this as so much of our Medicaid system will make these shifts. And it's such a huge part of our budget, it's something we really need to think about. So anyway, thank you so much, Councilwoman.
Thank you, Senator.
Any other questions for the Councilwoman? Thank you very much. The next person we're going to try to connect is Liza Birkin.
Thank you so much, Councilwoman.
Thank you, Senator.
Ms. Birkin,
Yes.
go right ahead. Just let us know which bill you plan on testifying on behalf of.
Thank you. Yeah, I will be testifying on S233, and I did not submit written testimony. Okay. Honorable members of the committee, thank you so much for the opportunity to speak. Like so many others, I have a healthcare nightmare to tell, and will be urging you to pass a universal single-payer healthcare system in Rhode Island so that the threat of financial ruin due to chronic illness and disability is not the driving force of my family's life and decision-making, nor anybody else's family. In 2018, my 32-year-old fiancé started experiencing bizarre neurological symptoms, which 8 months later, after 3 brain surgeries and 5 spinal taps, was found to be an extremely rare and dangerous brain infection. He's been in and out of the hospital ever since, battling this infection and its many awful secondary and tertiary effects. And ever since, every decision in his life and mine has been about healthcare: where to live, where to work, whether or not to get married, whether or not to go to graduate school, all dependent on his insurance status. This past March, he had a stroke and went to the hospital for over a month. Because of COVID, he wasn't allowed visitors and was essentially in solitary confinement, which led to him having a psychotic episode centered around delusions of losing his insurance and not being able to pay for his stay there. And nothing anybody could say made him think otherwise. The psychic costs of our private insurance system, knowing deep down that your family can be bankrupted, all of your dreams suddenly out of reach because of an illness or injury, is not how people living in the richest country or on earth or anywhere on earth should have to live. How many Rhode Islanders stay in jobs they hate with no growth opportunity because of insurance? And how many people stay in loveless marriages because of dependence on insurance? Our lives should not be governed in this way. There's been so much talk tonight on the direct savings that Medicare for All would provide, but I'm here to say that the indirect economic, quality of life, and self-determination benefits of a single-payer system are truly incalculable. So please, please take action on this bill so that all Rhode Islanders will have the right to be cared for and the freedom to choose their paths based on their dreams and talents rather than their copays. Thank you so much.
Any questions for Liza? Thank you very much for calling in.
Thanks.
Okay. Matthew, I hear you driving but pulling over. Is that true?
This is correct, yep.
Okay, thank you for taking the time out of your driving to safely pull over and talk to us about this legislation.
Certainly. Give me like 10 seconds on,
Sure.
on actually pulling
Yep.
through the application. All right, so I'm not sure how much time is budgeted for these, so I guess I'll keep it relatively quick, as I know you guys have a pretty busy evening, I'm assuming, pretty busy week. So I'll start off, I guess, just by saying thank you thank you for your service. Thank you for dedicating your time to serving Rhode Islanders and our citizens, especially this day and age. I know it's not an easy task. And so just from, as a citizen in our state, I just want to thank you. So let me start, I guess, by saying, though, I'm here in opposition to the single-payer system, and I'm in solidarity of the goal of ensuring that every citizen of Rhode Island does have affordable care and quality care, and I think our goal needs to be 100%. So I think there's a lot of agreement at times when people don't think there's agreement. However, I certainly disagree with the way to go about doing that, and I'm sure you've heard many people tonight give testimony in support of single-payer systems of healthcare, and certainly those testimonies can be, riveting and emotional, and quite frankly, areas of concern that need to be fixed. There's no question. I don't think anyone denies that, and I do think we should make that our goal. However, there's also heartbreaking examples of over 115,000, for example, that suffered in the UK in 2017 due to being diagnosed late, this is a tough one for me because I had some family members die of cancer. But, they essentially half the cancer people that died in Great Britain in 2017 were not diagnosed until late stage 4 cancer. And the reason cited was lack of staffing, lack of healthcare availability, lack of equipment and technology, and that was essentially because of lack of pay for services in those areas, which they have a single-payer system, and which is also used, quite frankly, a lot as an example of a successful single-payer system. So that's I feel, just the big reason, one of the big reasons of many why I just disagree with this legislation. I can give more examples from my friends. I have business customers in Canada. 2 months to get an MRI. They have to come across the state to get it within a week and pay out of pocket. So although you say it saves money on the customers, it actually doesn't. There's plenty of cases of ALS victims having to pay 30, 40, 50 grand out of pocket. So although you say single payer is compassionate, there's many, many examples that lead me to believe that's actually really not compassionate at all. And this is just real life examples of friends, family, customers. Even myself, I lived in Japan for several years and had really poor dental work done that caused massive complications in my mouth that had to be fixed when I came back to the States. And that was also a state-run medicine facility that I used. Private insurance, to me, simply equates to a higher quality of care, and I do think our standards should be very high. It's why a lot of people come to the United States for health care. Even labor unions, when they go to negotiate in the ACA, they wanted to really keep their Cadillac plans because there's a higher level of care. It just makes sense. In addition, just more reasons why I don't think this is a good idea. This has been tried in California, and they couldn't make it work. This is tried in Washington. They couldn't make it. This was tried in Vermont, which I know a lot of those who proposed this bill from Bernie Sanders. This was his idea. This is, you guys are, I'll say parroting. I mean, you're trying to improve and you're trying to do the right things, but this couldn't even work in Vermont, and they have, if my calculations are correct, maybe 400,000 less residents than us, and it had a shelve it based on simple economics. So in addition to the high cost of the care, the low reimbursement rates, the doctors, medical professionals, my wife is a nurse practitioner, and she works a mental health nurse practitioner, and it's unsustainable. You can't treat someone for 10 minutes, 15 minutes, and have them carry on the way of prescriptions. Life is more complicated than that. Mental health is more complicated than that. People deserve better care, especially for mental health, as this is a route for other unhealthy behaviors that lead to higher costs. So that's to me a big one in terms of, as I explained in my UK example. And to be clear, myself and many in my shoes who are arguing against this legislation, we we do want everyone to have health care. There is common ground. What we don't want is the full government takeover of a private industry, which is clearly going to lose jobs in our state. You even said it in the bill. You're going to re-educate people. It's no different. It's different, but it's similar to, we're just going to retrain oil workers in Arkansas, in North Dakota, and South Dakota, and these places that, off a stroke of a pen, lost six-figure jobs overnight based on politicians, based on policy, essentially. There's got to be a better way. There's got to be transitions. There's got to be, we can work toward common goals without upending the apple cart so much that it creates so much havoc. Another reason, I believe this is more from a constitutional side, but government control under a single-payer system. The executive branch has unadulterated numerous powers that goes against our founding fathers and the checks and balances in our nation, which has been incredibly successful for 250 years or close to. And then another reason, but certainly not the last, I'll wrap up. I know you guys are working hard. Is just trust. I really have lost a lot of trust in my government. I lost a lot of trust in when the ACA was implemented, for example. That was something that people said, well, the advocates of it, many in your room now, I'm assuming, or on Zoom, there was not bipartisan support in that bill. It was a late night Nebraska kickback that really put that over the finish line. And we saw it. You promised to lower the rates raised. You promised to lower my deductible raised. My doctor on the east side of Providence went out of business because he couldn't deal with it anymore. He said it was too complicated to even follow through. He would do something else with his life. So I lost my doctor, and I know many others have lost their doctor after you say you would do the opposite. And I just been so heartily in a disagreement with the proposals of just a draconian takeover of the government because several people think they know what's best. I think we need to be really more creative. I think creativity and figuring out really complex solutions is the hallmark of our country, is the hallmark of America. I saw it when I lived in Japan as a teacher. Very different ways of thinking, some good, some bad, but we are very creative people. We're very solution-oriented people, and that's citizens and that's politicians alike, all of us. So I just implore each and every one of you listening to this that you just think of maybe a little bit differently. I think we need to, maybe look at the Singaporean model that takes, and they spend a little bit less than 4.5% of the total cost on healthcare. It is both a combination of a hybrid, the government model as well as a private model that worked really well. And I would like to see us come to some common ground on such an important issue and not just single-heartedly have government control this, because once you do, there's just no turning back. You can't give away benefits. And, I know you want to raise money by, raising, just essentially doubling income tax in our state on a certain income level, but we have a small state. It's very easy to go across the border to Massachusetts, or my mom left. I haven't seen her in years because of it, because of high taxes, town taxes, property taxes, and the cost of living and income tax. So I just would hope everyone, thinks clearly on this before we act harshly. That might set us on a path that really doesn't help the solutions to what we're looking for. I thank you for your time, and I do on both sides of the aisle. I hope people come together and really work together and listen. Thank you.
Any questions for Mr. Gagliano?
I do not have any questions, I guess.
No, I'm asking the committee if they have any questions for you.
Sure, thank you.
So hold on a minute, I'll double check. I think you're free to go. I don't think there are any questions from the committee, but thank you for calling in and pulling over.
Yeah, no problem. Thank you guys and good luck.
Yeah. Next, we'll try to connect with Megan Lynch. Megan?
Yes, hello?
Go right ahead if you want to testify on any of the legislation before us tonight.
Okay, one moment. Hi, yep, my name is Meg Lynch. I'm testifying in support of Senate Bill 233. I did not provide a written testimony. I'm a member of Providence DSA, and I'm a citizen of Cranston, Rhode Island. Our current healthcare system does not support working families in Rhode Island. Every citizen who draws breath deserves to live happily and healthily without the looming threat of medical debt hanging over their heads. There is no exception to this. Healthcare is a human right, not a privilege. Under the current system, thousands upon thousands of Rhode Islanders are either uninsured or underinsured. My own financial situation was in flux last year once the pandemic hit. I was laid off of my food service job for a time, and I went back to work a little while later when business was very slow. I was just barely making enough to pay rent. Most pertinently, even though I do have health insurance, I had to stop meeting with my therapist during such an uncertain and lonely time in our nation's history because I could no longer afford a weekly copay. The global pandemic has collectively traumatized us as a society and continues to have a profound impact to this day. As someone who's struggled with depression, my mental health took a big hit, which I imagine is a sentiment that resonates with many U.S. citizens and maybe even some people in this room. I can't imagine what it must be like for the thousands of uninsured Rhode Islanders who haven't been as lucky as I have been to have gone to therapy at all. Creating a comprehensive health insurance program like the one proposed would give all Rhode Island citizens access to mental health services, among other crucial services, during a time when so many of us are struggling, both mentally and financially. I believe wholeheartedly that a program like RIDECHIP would make our communities stronger, healthier, happier, and safer. Rhode Island has real potential to pave the way for other states and be a leader in the fight for Medicare for all. I support this bill because the hardworking people of our state deserve it, but primarily because it's the morally correct thing to do. Thank you.
Any questions for Megan? Thank you for calling in.
Thank you.
Yep. Next, we're going to Megan Armstrong.
I support this bill because the hardworking people of our state
Ms.
deserve
Armstrong?
it, but primarily because it's the morally correct thing to do.
Can you
Thank
please
you.
turn down your feed for the broadcast?
Oh, of course.
Yeah.
Sorry.
Thank you. Go right ahead. Let us know what bill you wish to testify on.
Hi, my name is Meg Armstrong, and I have not submitted a written testimony. Respectfully to the members of the Senate Committee on Health and Human Services, I testify vocally today as an ordinary working citizen of Providence in support of Senate Resolutions S0233 and S0230. Rhode Island healthcare, as it is provided currently, is completely insufficient. Plans do not provide complete coverage for all necessary needs, an example, vision, hearing, dental, or mental health. For the existing price of these plans, they often still do not provide nearly enough coverage for the areas they claim to apply to. I find the limited access due to finance unacceptable and further disappointing that the care provided to those who may access it is still incomplete or inadequate. Too many Rhode Islanders are facing financial burdens from the initially steep and continuously rising healthcare costs. The insurance industry profits off of that fear by cruelly denying access to those with insufficient funds and further siphoning its growing wealth from those that struggle to meet the costs. As of 2018, according to the Rhode Island Department of Health, 8.1% of residents in the state are uninsured. According to the National Center for Coverage Innovation, Rhode Island had a 21,000 person drop in its health insured population between only February and May of 2020, a 55% increase compared to the 2018 levels. A study from Yale published in 2020 shows that a single-payer universal healthcare system would lead to 13% in national savings. On top of the ongoing COVID-19 pandemic placing severe pressure on a healthcare system that is already incapable of caring for its people, action is needed. Too many people have suffered and continue to suffer without adequate healthcare. No one should have to weigh the value of a doctor's visit against their weekly groceries. No one should have to face a mental illness with no way to seek diagnosis, treatment, or medication. No one should lose access to a life-dependent support because they can't afford it. No one should bear that their child sustain an injury that they can't afford recovery for. No one person should have to fear for their own or their child's or their loved ones or their family's care and safety. Rhode Island healthcare as it currently stands is unacceptable, and I am voicing my hope in support of S0233 and S230 to this committee so that we can take the steps towards the necessary healthcare justice in Rhode Island. I want to thank you all for listening and for your time, and I want to thank everyone that's testified so far and is waiting to testify or has attempted to do so. Thank you.
Any questions for Megan? Thank you very much for calling in.
Thank you.
Next, we're going to try to connect with Michael Niemeyer. Michael, are you with us?
Yes. Hi, Mr. Chairman. Welcome to the middle of the alphabet.
Yeah. We're
I'm calling to testify in favor of S233. I submitted an article I'd written, so I will paraphrase.
Thank you.
Last summer, my newborn daughter, Maeve, began having seizures. She was diagnosed with a rare brain disease called lissencephaly. There is no recovery from this disease, and the doctors told us that she'll never learn to walk or talk. It's a serious condition, and we were heartbroken, but I thought my little girl would at least be taken care of because I did have really good insurance through my employer. At the time, I did not know about a private insurance practice called lemon dropping. That's when private insurance companies make coverage really difficult for seriously ill patients to force them out onto public insurance. Right there, at our darkest moment, the nurse came in, and for the first time, I heard the words, "I'm sorry, but insurance says they won't cover it." We saw a tsunami of coverage denials, the likes of which I had never imagined possible. They denied coverage of a genetic test to find the cause of my daughter's condition. They denied coverage for a special chair to help her swallow her food. They even blocked the manufacturer of her medicine from providing us with financial assistance. That one's a real trip. They blocked us from getting help from a third party without ever providing us with a reason. Now, mercifully, we finally got her onto Medicaid, and our coverage problems actually stopped there. I don't tell you this story looking for sympathy. I tell you this story to highlight how the inefficiency of our system leads to cruelty. I've paid my private insurance payments, and I've paid my taxes. And when push came to shove, of those two, my taxes were the only investment that mattered. I hope we can move towards a system that's kinder and more efficient than this one. And I think any of these Medicare for All bills will move us in that direction. I'd like to thank the committee for taking the time to listen to everyone tonight.
Any questions for Mr. Niemeyer from the committee? Thank you for calling in. And
thank you.
It may be the middle of the alphabet, but it's the middle of the fourth out of 5 pages, so we're doing pretty good. Next, Miguel Sanchez. We might have heard from him already, but let's try. Mr. Sanchez? Mr. Sanchez?
Yep.
If you could turn down your feed so we don't get the feedback on that.
My apologies.
That's all right. Go right ahead. Let us know what bill you're interested in testifying as you go forward.
Yeah, I'm here to testify in support of Senate Bill 233. I also support Bills 49, 109, 230, and 231. I do not have any written testimonies. Hi, good evening, members of the Health and Human Services Committee. My name is Miguel Sanchez. I'm here to testify as a Providence resident, community advocate for our marginalized communities. But today I want to talk about my experience as a CSR with a company that is contracted with HealthSource RI. I assist low-income Rhode Islanders attempting to get health coverage all day, Monday through Friday, as my day job. As someone who works directly with HealthSource RI, which is the marketplace for the Affordable Care Act, also known as Obamacare, I would like to state that it is a very broken system that does not truly help all Rhode Islanders. I leave my job every day a little heartbroken because I'm not able to provide affordable health coverage and sometimes no health coverage at all to folks that I speak throughout the day with. These are very challenging conversations to have right now while so many people are suffering during this crisis that COVID-19 has caused us. For an example, a 27-year-old that makes $28,000 a year only has two options for health coverage that are below $100 a month premium here in Rhode Island, which at first glance doesn't sound too bad, but then you realize that those plans have deductibles of over $6,000 each, which is outrageous for one person. Another example of this broken system, I had a parent call the other day that was trying to get health coverage for her 7-year-old daughter. I was not able to start an application for them because no one in the family had a Social Security number. These are the types of upsetting situations that could be prevented if we had Medicare for all here in Rhode Island. How much money you have in your bank account or your immigration status should not determine if you have health coverage or not. Healthcare is a human right, and we need to start passing legislation that reflects that. The longer this bill stays in committee for further study, the more lives that will be lost. Thank you for your time, committee members, and also a big shout-out and solidarity to all the folks who have given testimonies tonight.
Any questions for Mr. Sanchez from the committee? Thank you for calling in. Next person we'll try to connect to is Nathan Levin Aspenson. Nathan?
Yes, speaking.
Go right ahead. You're on with the committee.
Thank you. This is the Health and Human Services Committee, correct?
Yep.
All right. Thank you for your time. I count myself fortunate, even though I am not very old at 33, to have so far avoided any kind of major medical catastrophe or long-term recurring medical condition because I have seen the havoc that the for-profit insurance industry and the current model of medical care in this country has done to friends of mine and family members and people that I care about. I have peers and friends and colleagues who are teachers, who are working in the so-called gig economy, who are uninsured or underinsured, letting health problems malinger or undergoing costly treatments that put them further into debt. And it has to be fixed. We cannot leave the next generation to be crushed under the same system that is currently grinding us into dust. I do not want to see more friends let their bodies break further to avoid financial ruin. And I don't think things should be modeled in this way. I think we have a chance to do something difficult but necessary. Figuring out a federal program at the state level will be tricky, but even when it comes from the federal level, implementation will still be left to the states, and we might as well start figuring it out now. We owe it to the next generation of Rhode Island's residents. That's all I have. Thank you for your time.
Any questions for Nathan? If not, thank you very much for calling in. Okay. Okay. Next to testify, we'll be calling in hearing from Nick Hallstrom. Nick?
Yes.
You're on with the committee. Go right ahead with your testimony.
Okay, sure. Hello, I'm here to give testimony on behalf of Senate Bill S-0233 to establish a comprehensive health insurance program, and I have not submitted any written testimony previously. Shall I go ahead?
Go right ahead.
Great. So like I said, I'm here to support Senate Bill S-0233, and my name is Nick Hallstrom. I live in Cranston, Rhode Island on Western Promenade in Senate District 28, and I'm also a proud member of the Providence chapter of the Democratic Socialists of America. But I'm primarily here as a citizen of Rhode Island to express my full support for Bill 0233 and a statewide single-payer Medicare program. I'd like to start by saying that if we've learned anything since the COVID-19 crisis began, it's that the state, both state and federal government in this, the wealthiest country in the world, has the duty to provide essential health and human services for all of its citizens, regardless of their means or access to private health care. The failure to provide this basic safety net for ordinary working families has played a significant role in a continually unfolding crisis that has seen 500,000 deaths nationwide. And here in Rhode Island, basically half of Rhode Islanders are either uninsured or underinsured, as has been previously explained by other folks giving their testimony. We've also witnessed a local crisis as our state's safety net has been stretched to its very limit during the pandemic, which I've experienced on multiple occasions since COVID came. I know Health and Human Services has been way past capacity, and that's not on you all, but that's on, you know, the system of austere government that a lot of folks have chosen over caring for our citizens. And I believe that the time for our government to serve the needs of the working class and our most vulnerable neighbors is now. While the efforts to pass a national Medicare for all legislation has stalled for the time being, the fact remains that our state government right here in Rhode Island can, and I believe absolutely must, pass a comprehensive, public, free at the point of service healthcare program in this current legislative session. Almost everyone has a personal story of how private healthcare has failed them, and I'll just share mine personally. It's certainly not the worst, but it is personal to me, and it's informed my opinion on this matter. I decided to go into business for myself in online retail only recently after years of working in Rhode Island at low-wage jobs in the food and music retail industries. Many of the small businesses I worked for could not or would not provide affordable employer-sponsored insurance. As a result, I found myself frequently in between the so-called affordable insurance policies that cost over $200 a month through HealthSource RI. I have a relatively severe mental health disorder, and many of my treatments were not covered by these policies, forcing me to pay out-of-pocket on an annual income of around $20,000. I've also struggled with substance abuse issues in the past, and again, with the same private healthcare policy, I could only barely afford the barest of treatment options, especially when it came to residential treatment programs. I've also seen a lot of friends of mine who have really sorely needed long-term residential treatment for substance abuse be pressured into outpatient programs or even just, like 1 week residential programs. And, if you all are familiar with the opioid epidemic, that's just not enough. And I know for a fact that people were covered more thoroughly, 30 years ago than now. So there's a lot of austerity in that front too. But many years later, I'm doing better and I'm in business for myself, but things have gotten even more precarious as I've actually had to drop my insurance policy altogether. Because I do not qualify for Medicaid, I'm now uninsured in the midst of COVID-19, just so that I'm able to pay off my business startup costs. I know that this story is only one of thousands of hardworking Rhode Islanders who have held up their end of the bargain, providing the labor and hard work that propels our economy forward, only to be left out in the cold when it comes to being provided with a minimum level of acceptable health care. There's already an abundance of data demonstrating government-run programs like ours, in the form of, VA-run programs that already exist. It proves that they do cut down on bureaucracy and cost and promote efficiency and cost control. Senate Bill S-0233 would mean Rhode Island would be a leader in efficient and humane healthcare policy that already enjoys widespread support from a majority of Americans and Rhode Islanders. I would like to close by noting that there is no serious administrative, logistic, legal, or fiscal obstacle to a statewide single-payer program in Rhode Island, despite what some may claim to the contrary. The only true obstacle is the political clout and influence of the health insurance industry, who have fought and will continue to fight to keep a statewide single health care insurance program off the table. And I'm here to let you know that Rhode Islanders will no longer accept anything less than a comprehensive public single-payer health care program in Rhode Island. I'm especially counting on my senator, Mr. Miller, to come out publicly in favor of this bill and to vote it through in committee and subsequently on the Senate floor. Thank you for your time.
Any questions for Mr. Hallstrom? It's nice to hear from such an articulate constituent and neighbor. I do support all the legislation on here. It's not a matter of whether I support the legislation or not and why I, preferred holding these bills. It's not because of the the legislation as a whole. It's because of the language currently used in it, whether it would be better or improved by examining some of the recommended language changes in them. So.
Okay, I take you at your word, but
Yeah.
we will be paying attention to how this legislation proceeds.
I have previously and historically actually sponsored and worked on very similar legislation in my Senate years.
Great, I appreciate that, and I appreciate you continuing to support the legislation in the form of 0233.
Next, we're going to try to connect with Nicole Eastwood. Ms. Eastwood?
Hi, yes.
You're on with the committee. Go ahead with your testimony.
Thank you. Hello, my name is Nikki Eastwood. I am testifying in support of Senate Bill 0233 as a resident of Johnston. In 2018, I found out I had melanoma and paid around $4,000 between the initial visit, the surgery, and follow-ups. I'm now required to see my dermatologist every 6 months. I rely on my health insurance to make sure my skin cancer doesn't come back. And although I am lucky enough to have health insurance through my employer, I am now currently on a payment plan for 3 different medical bills. I can't imagine what I would be facing by not having health insurance, and as someone who works for a floral designer, losing my job last year was and still is a real possibility. I support this bill because I believe health care is a human right and should be the right of every Rhode Islander, regardless of employment status. Rhode Island needs Medicare for all. Thank you.
Any questions for Nicole? Thank you for calling in and testifying.
Thank you.
Next, we have Natiha Salazar. Ms. Salazar?
Yep.
You're on with the committee. Go ahead with your testimony.
Hello, my name is Nita Salazar. I am a public educator and resident of Providence. I believe that it's absolutely essential that we pass Medicare for all legislation. It's very clear in the past year with this pandemic that there's a necessity for everyone to have access to health care regardless of their socioeconomic status, and that has just not been possible in our country with the way our healthcare system has been running, and it's not been possible in our state with the way our healthcare system has been running. Nobody should be denied access to medical care just because they can't afford it. Healthcare is a human right, and almost every other developed country in our world has a healthcare system that ensures that people have access to the care that they need in order to survive. So I can really only see a future in Rhode Island and a future for all the people in Rhode Island, not just wealthy people, if we pass Medicare for all legislation. Thank you. I yield my time.
Any questions for Ms. Salazar? Thank you for calling in. Nina Landau? Okay, next we're going to try to connect with Nina Landau. Ms. Landau?
Hello.
Yes, you're on with the committee. Go ahead with your testimony.
Thank you. My name is Nina Wolf-Landau. I am a Providence resident, and I'm here tonight to testify in support of Senate Resolution 230 and Senate Bill 233. I have an immense amount of privilege to have health insurance and to overall be pretty healthy, but I'm here tonight to speak in support and the importance of comprehensive health insurance as a program and to study what this would mean for our state. So many people in our state do not have access to good health care, and even I, as someone who has high-quality health care through my parents at this point, still really struggle to access the care I need and navigate the many challenges of the different kind of barriers that insurance puts up. We all have stories of loved ones and friends who've delayed essential health care or refused to get health care because they could not afford it. And you know, even though I'm someone who's had a lot of access to health care, it's still something that is deep and personal to me because of the loved ones I've seen who have really struggled to get the care they needed, whether that's for specialties and really specific problems, or even if that's just general primary care, which many of my colleagues in food service haven't seen primary care providers in years because they can't afford it. So to close, I just really want to urge each and every legislator to support 230 and 233, and especially in this moment when we have seen so many people negatively impacted by the COVID pandemic, this is really the time to act on a comprehensive health care program for Rhode Island.
Any questions for Nina from the committee? Thank you very much for calling in.
Thank you.
Next, we're going to attempt to connect with Norman Baker. We lost our connection with Norman Baker, so we're going to go next. I think we're on with Dr. Peter Trafton.
Yes, good evening, Chair Miller. Can you hear me?
Yes, we can. Go ahead.
For you and your stalwart committee, thanks for continuing to work so hard this evening. I'm Peter Trafton, Dr. Peter Trafton, a Providence resident, calling to support Bills 233, 230, and 109. I have filed written testimony. I would speak very briefly if allowed.
Of course.
I'm a retired orthopedic trauma surgeon. My work involved caring for severely injured patients and helping trainees learn to do the same. Many of our patients lacked health insurance. I'm going to kill that if I can. Can you hear me still?
We can still hear you. Yes.
Yes, many of our patients lacked health insurance or lost it after their injuries. I saw them suffer. I saw their lives and families disrupted. Some of them were bankrupted. Today's bills are significant steps towards better, more equitable health care for Rhode Islanders. Senator Mendes' bill calls for essential study of single-payer funding. Senator Calkin works for the long-awaited federal single-payer legislation. Senator Bell's 233 proposes a single-payer health care program for Rhode Island according to the foreseen pathway of Obamacare. Remember Saskatchewan? Their provincial plan succeeded and became Canada's highly regarded national health care. Please support single-payer health care in Rhode Island as soon as possible. Show America the way. Thank you very much.
Any questions for Dr. Trafton from the committee? Thank you for your testimony.
Good evening. Thanks.
Yep. Next, we're going to try to connect with Mr. Peter Nightingale. Mr. Nightingale?
Speaking.
Go right ahead with your testimony for the committee.
Okay, thank you very much. Can the committee hear me?
Yes.
Wonderful. I'm going to be testifying on behalf of the coordinating committee of the Poor People's Campaign in Rhode Island. We are a network of individuals, congregations, community organizations, and we all demand an end to systemic racism, an end to poverty, an end to the war economy, and an end to ecological devastation. And we support Bill 233, universal health care. And as a matter of fact, this bill goes a long way towards the second item on a list of 14 policy priorities formulated by the Poor People's Campaign, call for national moral revival. I'm not going to take more of your time by reading what that all might be. We submitted also a written testimony, and I encourage you to please read about what the campaign, the Poor People's Campaign, stands for. And all I would like to do at this point is not make your day longer and just thank you for your time. And this is basically my testimony. If you have any questions, I'd be happy to answer those.
Any questions from the committee? Thank you for calling in on behalf of the Poor People's Campaign.
Thank you for listening to my testimony.
Yep. The next person we're going to try to reach is Randall Rose. Randall?
Yes.
Are you with us?
Yes, I am.
Go right ahead.
Okay, thank you, Mr. Chair and members of the committee. I'm glad to be speaking in favor of this bill. We do have a lot of problems with our healthcare system, and there were a lot of hopes that the Affordable Care Act would help to control costs. That clearly is not working. And healthcare prices, including drug prices and other parts of the system, are becoming more and more unaffordable. And I think this bill takes the right approach in looking for an alternative. It's good to have a study commission that can explore the different issues involved and do some talking with the different constituencies that matter, including ordinary people who have healthcare affordability issues under the current system. So I think this kind of study commission approach is a very good one. I happen to believe that it is worth taking seriously when people have concerns about a completely government-run health care system. I think it's worth considering whether things might be done better with a nonprofit administering health care cost control. I think there are ways of doing that will avoid the problems of the current system and won't trigger so much anxiety about a government-run system. But that's the kind of thing that this kind of study commission can explore. And I think we can and must do better than our current system. And it's good to have a deliberative, consultative process for looking for an alternative, and that's what this bill does. So I'm glad to support it. Thank you.
Any questions for Randall? Thank you for calling in. Next, we're going to try to connect with Sammy MK. Sammy?
Yeah.
Go right ahead. You're on with the committee for your testimony.
Oh, great. Thank you so much. My name is Sammy Omke, and I'm here to testify as a community member, a pre-medical student, a former COVID case investigator at the Department of Health, a community organizer with the Providence chapter of the Democratic Socialists of America, and most importantly, a citizen of Providence, Rhode Island, in support of Senate Bill 233. I first want to start with the story of a dear friend right here in Rhode Island. She's 21 years old, just like me. She takes care of her health. She tries to stay on top of her regular doctor's visits as much as she can, but through no fault of her own, was born with a myriad of dental problems. She needed extensive work to bring her teeth into alignment, or else she would have had to get her teeth removed and replaced. As you all should know, dental work is not cheap, and it's not considered a, quote, essential health benefit. And because she's not a wealthy person, my good friend could not afford private supplemental health insurance. She's on Medicaid, and in the state of Rhode Island, as a result of the choices legislators make, she's not eligible for free or reduced dental care as she's too old for it. Apparently, her ability to eat without excruciating pain is not essential. It's not worth having coverage. So what did she do? She found the safety net clinics that provide free or reduced cost services, but she found most of them restricted to kids or adolescents. And the ones that didn't were next to impossible to get an appointment anytime in the near future. She could barely eat and was reduced to soft foods and smoothies and painkillers. So she did what many families inevitably do. She reached out to all her networks, found a friend of a friend, and was able to provide her dental care for free at their clinic, which is not legal. She had to circumvent health care to receive health care. And for what? To protect the profits of Neighborhood and Blue Cross Blue Shield. This must end. I only bring this story up not to drag her experiences through the limelight, but to remind you that all of us have loved ones who have gone through similar experiences. We often hear the word access and affordability when it comes to healthcare, but ask yourself, if you or your loved one were in the middle of a medical emergency, would you want to first call your insurer to see which hospitals are in network, which doctors are in network, which prescriptions are on the formulary, so on and so forth? No, the obvious answer is no. Insurance companies' only job is to maximize profits, so that means charging us higher and higher premiums, co-payments, deductibles, while denying us claims and making us fight for our own health. This is not the way that a developed nation, the richest nation, as some have pointed out in the history of the world, should treat its own people. And that is why I'm calling on all the senators here to pass this bill out of committee. And I've heard that you already put it on hold, which I'm very disappointed to hear. And I would urge you to reverse that decision and send it to the whole chamber. We can't afford for our own lives and our own sake more premiums, more co-payments, and more bargaining with our lives. If you continue to kill this in committee, as it were, if you send it to further study, that is your choice. But I want you all to know, specifically my state senator, Gail Golden, who I believe is on the committee. Correct me if I'm wrong, but you haven't responded to my emails about eviction moratoriums, so I wish you would. But I want everyone to know that we, the people, will organize in your districts, in our neighborhoods, and we're going to take action. And it might be against you. These are our seats. This is our Senate. And as Winston Churchill once said, a kite flies against the wind, not with it. And that's why I urge you to fly against the wind. Buck, Shikarchi, and Ruggiero, and whoever else is, the goons they've sent to tell you to kill this bill in committee, fly against that wind, because before you know it, the winds of change are going to turn against you, and there will be nowhere to go for your own career but down in the State House. I ask that you bring this bill out of committee into a vote. Healthcare is a human right. My contact info is email SAMY_AMKIEH@brown.edu. And my phone number is 985-789-6707. I'm very happy to talk, and I urge you all to support this bill and put it to the floor. Thank you.
Yes, I just want to repeat, I think I've said it a few times, and I said it in the beginning of the meeting, that we have notes on all these bills to not kill them, but improve them, so they would have a better potential for passage. And that includes all the bills, including Senator Calkin's Bill 109. I know it's a resolution to the federal delegation, but it does have about a half a page of notes on updating and making more accurate several of the whereases on the bill. It would actually be a better bill if, as I offered, that the sponsors and the committee members saw those notes and take them into consideration. So I do want to take this opportunity to respond to your comments that at least in the Health Committee, a vote to hold for further study is a vote to hold for further study. It's not a vote to kill. And that is true with all the votes on this committee. And I think you can historically look back and see that that is exactly what we have done with much of our important legislation. And so I just want everybody, including those who have called in, to take that into consideration when they try to understand why we hold a bill or pass a bill. The next person we're going to try to... Senator Bell?
Oh, just briefly, I do want to thank you, Chairman, for agreeing to share these notes with us and help us work with the committee staff on further amendments to these bills so that we can bring them up for passage later on in the session.
Next, I believe we have Shannon Morgan on the line. Shannon?
Hi, yes.
Go ahead, let us know what bill you want to testify on behalf of.
The Medicare for All bill.
Okay, go right ahead.
So, should I state my name, or is this being recorded? Hello?
It's on the Capital TV broadcast. You can state your name if you wish. I've already said your name, but go ahead, whatever you're comfortable with. Yep.
All right. So my name is Shannon Morgan, and I am testifying for Medicare for All. I believe that everybody has the right to have access to free health care. And I would love for Rhode Island to be a leader in that. So, yeah, that's what I'm standing behind.
Any questions for Shannon? Thank you for calling in. We very much appreciate it. Next, we have Sari Green, who we're going to try to connect with. Ms. Green?
Hi, yeah.
Go right ahead. You're on with the committee.
Hi, thank you. My name is Sari Green, and I'm testifying as a public health servant and as a citizen of Rhode Island. There's a story that I hear a lot. Friends, clients at work, my mom have put off essential medical care because they could not afford it. Without the health care they need, the same people become sicker, requiring even more expensive medical care later. A comprehensive insurance program would make it so that every person in Rhode Island would have access to health care, and that is free to them at the point of service, which would remove a major barrier that prevents people from getting the care that they need. The coronavirus pandemic has done a lot of things in highlighting the deep cracks in our healthcare system, with no exception. Now more than ever, we need to make sure that every Rhode Islander has access to essential healthcare services when they need them without worry that they'll go into medical debt. I identified myself as a public health servant, but I really want to testify as someone who needs better access to healthcare services. 3 years ago, I learned I was born with a genetic condition which requires taking medications for the rest of my life and multiple specialist visits per year to manage symptoms and monitor for issues. Since my diagnosis, I've found myself without affordable health care and affordable health insurance 2 separate times. Both times I was between jobs, making too much on unemployment insurance to qualify for Medicaid, but not actually able to afford the cost of the options in the marketplace. Both times I've had to pick and choose which medications I could survive without so I could pay for the most essential ones out of pocket. Even after starting a new position, I still had to pay out of pocket for 3 months until the insurance tied to my job kicked in. And having a comprehensive health care plan like RICHIP would have changed my life during these times, and it would provide security that I'll be able to manage my health in the future. This last year has been unprecedented. So many lives have been lost, and the jobs people depended on for their health insurance and livelihood are gone. And the stress of this time is insurmountable, and we'd be foolish to think that the actual COVID-19 virus will be the only negative health outcome that will occur as a result of all of this. So we will need years of healing, healthcare included. So I just think that now's the perfect time to create a comprehensive health insurance program. Thank you for your time and consideration.
Any questions for Ms. Morgan?
I do not.
From the committee, any questions? Thank you for calling in.
Thank you.
Next, we're going to try to connect with Tal Frieden. Tal?
Hi.
Go right ahead.
Can you hear me?
Yep.
Thank you. My name is Tal Frieden. I am a resident of Providence, Rhode Island. I did not provide written testimony, and I am testifying in support of Senate Bill 233, as well as the Senate bills to audit our MCO providers here in Rhode Island. I'm testifying today because creating a statewide single-payer system is the only way to prevent people from taking on medical debt. My family is fortunate enough to have health insurance through my father's job, but when my mother was diagnosed with breast cancer about 20 years ago, my family had to take on debt in order to pay for her care. For better or for worse, I was young enough at the time that I didn't see my mother struggle with her cancer, and I am lucky that she is fully recovered and is in remission. But I have continued to watch my family struggle with the long-lasting debt that ensued from her illness. My family is still paying off debt from that time, and it has affected all of our lives. Creating a statewide single-payer system is the only way to prevent people in our state from taking on medical debt. It's time that we stop forcing people to go into debt to take care of their loved ones, and it's time to ensure that we all get the best health care that we all deserve in the wealthiest country on earth. I'm really grateful for all of the members of the Providence CSA and Reclaim Rhode Island, organizations of which I'm a part, who have testified earlier today to talk about the very personal experiences of navigating a profit-driven healthcare system that does not care about our families and our needs. But it's not just that medical debt and our profit-driven system are hurting our families, it's also a drain on the state's budget, which has been outlined by multiple speakers as well. Currently, Rhode Island spends hundreds of millions of dollars on our private Medicaid providers, MCOs, and we know from the experiences of our neighboring states that it doesn't have to be this way. As has been mentioned, in 2012, Connecticut got rid of the private insurers who were administering its statewide Medicaid program and were overcharging the state by hundreds of millions of dollars. Since then, average monthly costs per patient on Medicaid have gone down, more doctors accept Medicaid, and critically, fewer patients rely on costly emergency room visits to receive care. Statewide single payer is the only way to ensure that no one in Rhode Island has to take on medical debt. And it's also the only way to ensure that we all have access to the care we need. It's clear from hours, at this point over 5 hours of testimony, nearly unanimously in favor of passing statewide Medicare for all, that the people of our state are strongly in favor of a statewide single-payer system. Not only is this politically popular among Rhode Island's populace, it has been shown that it would save the state money to pass a single-payer system, and at the bare minimum to transition from a privately administered Medicaid system to a publicly managed fee-for-service Medicaid system. So here we are, hour 5 of public testimony in favor of statewide single-payer, and the question is not whether there's support for single-payer or whether it will save our state money, but whether there's the political will to take on private healthcare companies that are headquartered in our state and that have used our and our families' medical diagnoses and medical difficulties to wring a profit out of the people of Rhode Island. So I'll just leave with a question for the senators on this committee as well as the senators in the Rhode Island State Senate. Do you have the will to do what's right for the people of Rhode Island and to pass statewide single payer, a wildly popular program, and one that would save the state money? Thank you.
Any questions for this witness? If not, we'll move on and try to connect with Rachel Baker. Ms. Baker?
Hello, my name's Rachel.
Thank you for holding on to testify.
Oh, no problem. Tell me when to start.
Go right ahead.
Thank you so much. My name is Rachel. I'm here to testify in supporting the Senate Bill S0233, the Comprehensive Health Insurance Program. And I am a member of Providence, and I've grown up in Rhode Island my entire life. And I am calling today because I am actually doing this treatment right now that is costing my family $8,000. And that has already billed my insurance $15,000. And that is like on top of what my mom already has to pay for the insurance, which is $7,000. So my mom has to pay $15,000 with insurance
just for me to get this life-saving treatment that I need. And if I don't get this treatment, then, who knows what would happen. And I also know that I'm speaking of a place of, like, immense privilege. There's so many people like me who just don't have access to this healthcare that is so desperately needed. So they go their entire life suffering. So I need to ask this committee, or need to tell this committee, if you care about the people of your state, then you care about their health care. You care if they have access to health care. And you give that to them. You have the power to give them a life where they don't have to worry about something as basic as going to the doctor when they're sick. Or they don't have to worry about whether they're going to sell their house to pay for their, their grandparents or their parents' medical bills. Yeah. And I guess, please just support this bill. And that's all I have to say.
Well, thank you for calling. Does the committee have any questions for Ms. Baker? Thank you very much.
Thanks.
Next, we're going to try to connect for a testimony with Thomas Sicoscio. Mr. Sicoscio?
Yep, this is him.
Go right ahead with your testimony. You're on with the committee.
Okay, thank you. Hi, my name is Thomas Sicoscio. I am here to testify as a citizen of Warwick, Rhode Island, more specifically Oakland Beach. I'd like to thank Jeanine Calkin for being here and for being so supportive. I am here to support Senate Bills S49, S109, and S233. And I did not submit written testimony. Am I okay to start?
Yes, go right ahead.
All right, thank you. Rhode Islanders are strong. We believe we survive blizzards, hurricanes, nor'easters, and whatever else the world can throw at us. The ocean state knows how to adapt and overcome. Rhode Island is fighting one of the biggest battles in its history. The COVID pandemic has ravaged the state harder than any other natural disaster. The hurricane of 1938 killed around 600 people. The blizzard of 78 killed around 100. COVID has killed over 2,500 people. After the damage caused by Hurricane Carol, Providence built a $16 million flood barrier and has not been flooded since. If a hurricane that killed 19 people can trigger large-scale restructuring of the waterfront, a pandemic killing thousands can trigger large-scale restructuring of the healthcare system. Between February and May of 2020, about 21,000 Rhode Island residents lost their jobs and health insurance. By mid-2020, the number of uninsured people rose about 40%, according to Families USA. In 2019, Health Source RI said 30.4%, that's 306,000 people, were underinsured in our state. Much like Providence prior to the flood barriers, Rhode Island's community health plans have too many holes. I would hope that the members of this committee would not lock the pores out of the floodgates at Fox Point in the next flood. There is no better time for us to reform something that has become essential for many, just as the barriers on Fox Point. Medicare for All in Rhode Island can help us end this fight against COVID and prevent another health crisis like it in the future. Thank you for your time.
Any questions for Mr. Sicoscio from the committee? Senator Calkin?
Thank you, Mr. Chair. I just wanted to thank you, Mr. Sicoscio, for testifying tonight and for your support on these bills. It's great to hear local constituents, especially at 9:23 at night, have the stamina to testify before us on these important bills. So thank you so much for doing that.
Yeah, thank you as well. I've been listening the whole time. It's been a long night for everybody. Thank you so much.
The next person we'll try to connect for a testimony is Tom Chiari. Tom? Mr. Chiari?
Yes.
Go right ahead with your testimony. You're on with the committee.
Okay, thanks. My name is Tom Chiari. I'm here to testify as a resident of Providence in support of all of these bills. There's already been so much incredibly moving testimony in support of all these bills, and hearing all these stories, I count myself pretty fortunate for not having experienced the worst that our healthcare system has wrought on so many. I'll be brief and just share one of several personal experiences. On January 4th of this year, my wife and I welcomed our first child into the world at Women and Infants Hospital. Immediately, we were thrust into making cost-benefit decisions on both my child and my wife's care. After delivery, should my wife take antibiotics preemptively, as the doctor recommended, or should we wait and hope that she doesn't develop an infection? We waited. Still, the pharmacy bill for her only medication, which was over-the-counter Motrin, for our 2-day stay was $500. Do we really need to consult a lactation specialist to ensure our daughter is getting adequate nutrition? We did end up seeing one twice during our stay, and we were billed for $684 each time. How quickly can we safely leave the hospital? We were billed $2,000 per day for 2 days of room and board. But the scariest moment by far was 4 weeks postpartum, when my wife developed persistent pain in her abdomen along with a fever. We waited for days for it to pass. How much would an emergency room visit and potentially more care cost? Do we tough it out to save money that will give our daughter a chance at a better life, money for food, for housing, for daycare, for education, or is my wife's life in danger? Even with coverage, these are the types of decisions people are forced to make in a system where companies provide as little coverage as they possibly can in order to maximize profits. And that was just 2 days into my daughter's life. We were forced to make all these really kind of difficult decisions. And like I said, I count myself fortunate we're in a position where it wasn't such a difficult decision, but for many it's not that easy. So, as you guys hold these bills for further study, I urge you to consider that while you do so, these types of decisions are being made and agonized over every day. On top of that, 450,000 Rhode Islanders are uninsured or underinsured, and the pandemic is raging through our neighborhoods. So I urge you to study quickly and then to put these bills back on the calendar and to pass them immediately. Thank you.
Any questions for Mr. Chiari from the committee? Thank you for calling in.
Thanks.
Next, we are going to attempt to connect with Tom Hendrickson. Mr. Hendrickson? We'll try that one again. We're down to the last few, just in case people are wondering. Mr. Hendrickson?
Yes, hello.
Go right ahead with your testimony for the committee.
Thank you. My name is Tom Hendrickson. I'm currently a student at Providence College and the vice president of the Providence College Democratic Socialists. I'm speaking today on behalf of our organization in support of Senate Bill 233. I wanted to share the story of our organization's founder and president. He wasn't able to be here tonight to speak, but I can share his story on his behalf. Several years ago, his mother lost her job, and as a result, their family lost their health insurance coverage. At the time, they had to pay over $1,000 a month for COBRA insurance, which for someone who had just lost their job is an exorbitant amount of money for such inadequate coverage. Unfortunately, our president's situation was not unique. I have members of my family that cannot afford health insurance, and many of our organization's members can say the same. There are nearly 30 million Americans that cannot afford health insurance all around the country. Every year there's an estimated 45,000 Americans that die because they cannot afford health insurance, and every year there are an estimated 500,000 Americans that file for bankruptcy as a result of medical expenses. This does not happen in any other developed country in the world, where health care is considered a right for all people and not a privilege for only those who can afford it. No one should have to die because they can't afford health care, and no one should have to be damned into insurmountable debt and poverty because of healthcare issues that are out of their control. The Providence College Democratic Socialists are committed to fighting for justice, equity, and human rights, and as such, we implore the committee to support Senate Bill 233 for single-payer Medicare for all. Thank you.
Any questions for Mr. Hendrickson from the committee? If not, we'll move ahead to Mr. William Colwell. Mr. Colwell.
Hi. I have no written testimony. I'll be quick because I know everyone's tired. Thank you for listening to me. I'm here in support of bills S233 as well as 49, 109, 230, and 231. I'm a 50-year-old resident of Providence. I work as a mental health social worker. I'd like to share a few things that other people haven't talked about. One of them is that I've worked in geriatric psychiatric hospitals, and I've watched how the insurance companies sort of act as parasites and leeches, where people at the end of their lives, families that are being held together often by people who are senior citizens because people live in their houses, lose the house. And it's a horrible thing to see. I've been listening now for a while, and I've only heard one person sort of against the bill, but even they recommended the Singapore model, which I'm not very familiar with, but anything has to be better than what we have right now. I see a system where old people get ripped off by insurance companies and nursing homes and private hospitals. I see working class people get hurt the most. I just talked 2 days ago to a client who told me he had $35,000 in bills for a 1 week stay in a psychiatric hospital. Every day my heart breaks. I have been in and out of working in mental health since 1993, and I want to say a story from when I started. This was in Massachusetts. I was doing admissions in a detox primarily for heroin addicts, and one of the administrators picked up the census, and he looked at it, and he said, yes! And I'm like, why are you cheering? And he's like, we have 8 people out of 70 with AIDS. And my heart broke because this guy was happy that we had so many people with AIDS in our hospital, because it meant that he would get 5 times the pay for somebody with AIDS. Our system is warped and immoral. A cousin of mine, his son and wife, the wife has Mexican citizenship. They went across the border to have a baby because it would cost $500. One thing that happened in 2020 that got ignored because of COVID is that Mexico, with an alliance between its right-wing parties and its liberal party, were able to set up an extended version of universal health care by using both public and private solutions. Now, I just want to end on that. It isn't just the rich countries like Canada and Western Europe that are extending universal health care. It's countries like Mexico, Panama, Costa Rica, Belize, Cuba. What our system is doing is inhumane, immoral. It is parasitic against the working class. It only seems to benefit the poor and the rich. And thank you, and have a good night.
Thank you for your testimony. Are there any questions from the committee for Mr. Colwell? Thank you for calling in. Next, we're going to try to connect with Troy Lang. Mr. Lang?
Yes.
Go right ahead with your testimony. You're on with the committee.
All right. My name is Troy Lang. I'm an attorney recently admitted for practice in Rhode Island. Currently, I'm a law clerk with the Superior Court. I know it's been quite a while since this, but I thought Senator Bell's comments earlier in the evening, the very beginning of the evening, were really spot on. The bottom line is that several other countries have working single-payer healthcare systems that provide top-notch care at annual costs to citizens that are far below the annual costs paid by Americans. It's a terrible state of things where random illness or injury can completely ruin one's financial well-being through no fault of their own. Some of those listening may be familiar with the case of A.J. Quetta, who was a high school student at Bishop Feion High School in Massachusetts, who was severely injured while participating in an ice hockey game not too long ago. There's been a wonderful outpouring of support from the hockey community in the area. In fact, tomorrow night, I will be refereeing a game that's part of a fundraiser tournament for the benefit of Mr. Quetta. While the community support is amazing, I cannot help but think of the countless people who suffered from similarly random accidents that were not the beneficiaries of such community efforts. Instead of relying on the goodwill and generosity of strangers, we ought to adopt a single-payer healthcare system that guarantees support for all those who need it, so that none have to live in fear of random financial ruin. So, I'd just like to express, I'll keep it short for y'all, since you've all been here for a while, but that's all, and I hope that, I know you guys have already tabled it for further study, but I hope that you can come back to this session and get SB 233 advanced to the floor later on. That's all. Thank you.
Any questions for Mr. Lang? Senator Calkin has a question for you.
Thank you, Mr. Chair. And thank you so much for your testimony and reminding us about the young hockey player. I remember seeing just yesterday about a 7-year-old girl selling lemonade to help pay for her brain surgery. And you bring up a really good point. We shouldn't have to rely on things like GoFundMes and similar type of, fundraising in order to have the surgery or the care that we need. So thank you for bringing that up. Appreciate it.
Quite welcome.
Any other questions? Thank you for calling in. We'll try to connect with Xantha McCartney. Ms. McCartney?
Yes.
Go right ahead. You're on with the committee. I don't know how often your your first name is used for the order in which you testify or line up for something.
When I heard we were doing alphabetical order by first name, I knew it was going to be a long night. But thank you all so much for staying and hearing testimony. My name is Xantha McCartney, and I'm testifying in support of Bill 233. I'm a constituent of Senator Valverde, and I met her last year when she was coming and knocking doors in my neighborhood, and I remember her asking me if there were any issues or concerns that were important to me, and at first I was like, no, I can't think of anything. Then I was like, wait a minute, yes, I can, and talked to her for a very long time about health care. So I'm very passionate about it, and tonight I'd like to tell you about my daughter. My daughter is 12 years old, and she has multiple disabilities. She's had life-threatening medical problems since she was born. When she was 2, she was diagnosed with intestinal failure, and when she was 3, she started receiving parenteral nutrition, which is IV nutrition. And it was good. She gained weight, and her health improved, but when she was 4, her liver began to fail because the lipid component of IV nutrition is hepatotoxic, and babies and children are especially vulnerable to that type of liver disease. So we were looking at transplant, either liver or multi-organ, and then we were offered with another possible treatment, which is a specialty medication that's used specifically for the type of liver disease that she had. And this is where the insurance part comes in. At the time, I was married, and we had an employer-sponsored PPO. They immediately denied coverage, which we expected. So we went through the appeals process, and the final appeal was a call between my daughter's specialist and the insurance company's medical director. And the message was, we will never pay for this, and we don't have to. And that was bad enough, but it was exacerbated by the fact that if we had a comparable plan through the same insurer in Massachusetts, her treatment would have been covered. And we had insurance, and this is just an example of the cruelty of insurers who have ultimate power. Because even for those who have insurance, what might seem like a minor difference in coverage can be the difference between life and death. And as I said, my daughter's 12 now, so she got through this. Her treatment was covered by a disease-specific fund financed by private donors. And she may need a transplant in the future. But without that medication, she would not be here. So that's just one of many experiences I've had with my daughter. And I'll try to be quick with the others. But another was when we ordered her first wheelchair, her first self-propelled wheelchair. And again, our private plan denied coverage. She had secondary Medicaid, and they approved her chair, but it was a really long process. 2 weeks after her chair was delivered, I received a bill for $9,000. Because during the time it took for Medicaid to approve the wheelchair, the durable medical vendor was bought out by a larger company who no longer accepted Medicaid. And our private insurance still wouldn't pay. So what should have been like an absolutely 100% happy occasion was just marred by receiving a huge bill for that. And the other thing is that keeping insurance dependent on employment, as I hope we all know, is dangerous. None of us is guaranteed a job forever. And if we're covered through a spouse or a parent, that's equally problematic. When my former spouse lost her job, through which my children accessed their health insurance, I found out through a phone call, and it was not from her, but from my daughter's infusion company. And I remember standing in the kitchen in shock as they told me that they would not be delivering the IV nutrition that keeps her alive, and that they would be sending someone out to essentially repossess their infusion pumps. They then transferred me to their billing department so that I could make an arrangement for the $15,000 I now owed for the prior week's delivery because the plan had canceled retroactively. And I was shocked by the amount until I realized that the EOBs I'd been receiving, that was the discounted insurance rate. And now they were charging me like at the patient too bad for you rate. So this isn't working. This is not working with Medicaid managed care plans. It's not working with private insurers, and we need a single payer plan in Rhode Island. I mean, we've heard so many testimonies tonight of like really compelling stories, and we don't have any more time like to wait to do this because people's lives are on the line. And again, this is so important to me, as I know it is to you, and the difference between life and death. Thank you so much for hearing my testimony.
Any questions for Ms. McCartney? Senator Valverde.
Hi, Zan. I just wanted to say thank you for hanging in there tonight and sharing your experiences with the committee. Really appreciate it.
Likewise. Thank you so much.
Anybody else? I want to thank you also for calling in. We know, I think anybody who's been on a health committee or paid attention to health policy, either locally or nationally, knows there's a range of issues, both locally and nationally, that need to be addressed. And a lot of these bills would be very much part of the solution. As we're going to just review. I think Xantha is probably the last person we have to testify, but while we check that and before we adjourn, I do want Senator Calkin to know, and she's willing, if she's interested in changing her vote after this and encouraging others to change their vote on 109, we can do that. But we do have, as I said earlier in the committee, when we started a few hours ago, that we did have notes from our attorneys that I think would benefit all the bills, and I know a resolution, it's hard to think that there would be issues that could be solved by or improvement from the legal counsel, but I believe even that resolution would be served well by looking at the concerns of legal counsel, and they go to, I know it's a series of about 3 pages of whereas on why we want Congress to pass legislation establishing an improved Medicare for all system, but the legal notes do address several of the 15 or 20 whereas's to make them more accurate and bring them up to date, and which would only enhance the bill's potential for passage and not delay it. So that's why I discussed and brought that up before we had motions on the bill. So as people consider their vote to hold, that they would keep that in mind. Obviously, that didn't happen. If you think it's important for the senators to look at those notes, you might want to consider a change of your vote.
Thanks, Mr. Chair. Given the 100 people or so that spent 5 hours and 45 minutes, I don't want to change my vote. I would definitely be interested in seeing some of the language from the council and consider putting that into an amendment on the floor. But I think, given how many people came out and how passionately they care about this, to me, this is the least that we can do is to ask our federal delegation to support Medicare for all. So, I'd be willing to change some of the
that too,
facts.
and I believe they're better served by having an accurate and well-crafted bill. And so that's why I did vote to hold it, because I think we can improve.
Sure, and I understand, there are many advocates who put forth this bill, so I want to honor them as well.
Yep.
If I may, I do want to thank the chairman for offering to share us these notes. It's not something that always happens. So it is something I really do appreciate. I'm really looking forward to reading these notes, speaking with Mr. Weinberg, and going into detail with him about the specifics of the legislation. Really looking forward to it. So thank you so much, Chairman, for sharing these notes with us.
Yeah, it's much easier and more productive to do it on a held bill. That's all I'm trying to discuss before we adjourn, that a held bill is much easier to change. And I reiterated not only this year or this meeting, but in previous years that in this committee, and I think the record is very clear on that we improve bills by holding them in this committee. And that was what I endeavored to do and why I recommended a hold vote. If there's no further discussion within the committee, motion to adjourn.
Senator Miller?
Yeah.
Before we adjourn, can I be recorded on the votes that we took tonight, please?
Do you want to be recorded? So we voted to hold number 49. The committee voted to pass 109. We voted to hold 230. We voted to pass 231 and to hold 233. Do you want to be consistent with the committee vote on those, or do you want to vote to hold certain bills?
Yes, I'll vote yes on 109 and 231, and I'll vote to hold 49, 230, and 233, please.
Does the clerk have that? Okay, thank you. Yes. Motion to adjourn?
Thank you.
So moved.
All those in favor?
Aye.
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 Thank you for sticking around for 5 hours and whatever.
Thank you so much, Mr. Chairman.
Yep.